access health.
And I'm Audra Jones of the Los Angeles County Department of Public Health, here representing our county-wide African American Infant and Maternal Mortality Prevention Initiative. And we're here to inform you of an exciting training opportunity that is coming on August 17th from 2 to 4 p.m. We are presenting Real Talk, Real Options, using the PATH framework to support reproductive autonomy. This is a two-part training series for professionals serving Black women and birthing people.
So join us for this series, and in it, participants will learn how to provide patient-centered counseling and how to engage Black patients in affirming, unbiased, non-judgmental conversations about sexual and reproductive health. Participants will lead with tools to empower their Black patients throughout their sexual and reproductive health journeys and support their overall health and well-being. Part 1 of the training series is an introduction to sexual and reproductive health, consisting of an on-demand online comprehensive review of human sexuality that includes an overview of the reproductive anatomy, all available birth control methods, and STI risk reduction information presented in a reproductive justice lens, with suggestions on how to use inclusive, non-gendered language that can be taken at your own pace and at your own convenience. Take this before part 2. Then part 2 is PATH, and PATH stands for Pregnancy, Parenthood, Attitudes, Timing, and How Important. And this is provided in an interactive live Zoom training on patient-centered reproductive goals counseling that builds upon the foundation of Introduction to Sexual and Reproductive Health. This two-part series will enable you to engage in real talk with your patients and clients, helping them to understand their real options in a way that focuses on their needs, their desires, and their health and well-being. The next virtual session will take place August 17th at 2 to 4. So register at bit.ly/August17 enroll.
So we don't want you to miss it, because we know that a joyous and healthy birth takes a village. Join us to hone your communication and education skills, and join us in the fight to end the deaths of Black mothers, birthing people, and infants in LA County, and to support a healthy pregnancy and birthing journey. The African American Infant and Maternal Mortality Prevention Initiative, in partnership with Essential Access Health, looks forward to working with you and seeing you soon.
Thank you, and we'll see you there.
Good morning. Audra, was that it? If so,
Yes, Dan, you're ready to go.
aha. Okay, my name is Janet Robinson Flint. I am the Executive Director of Black Women for Wellness and the interim for Black Women for Wellness Action Project. I'm stepping in some big shoes for a moment there from Nerbese Nana Flint, but that's okay. We'll keep making it happen. So, welcome to Code Red, Sheroes for Human Rights. So for when it comes to reproductive justice in America, we got a lot of work to do, but we got a lot of sheroes. We got a lot of people who don't wear a cape, but might need a cape because they are putting in the work. And Black Women for Wellness is lifting up that energy for Black August to let us know that when we fight, we win. We got folks in the fight. We got folks who are making it happen. And a lot of them are joining us this morning. And a lot of them joined us last week too. So this morning we're focusing in on maternal and infant health. We have some super duper fabulous doulas who are here to make it happen. We have Ms. Audra Jones here, who has been a superhero in Los Angeles County in California, making sure that we keep Black mamas at the forefront in vision, in focus, and moving us forward. So thank you, Audra, who is my partner in crime and in do good, as we move and shake California, as we make sure that we keep the lives and lived experience of Black women on people's minds, so we stop dying. Oh my goodness. No, not you on mute. I
Yeah,
can't.
you know, I was saying.
No. While she's on mute, we also have Black August happening, and we also have Pan-African News, and it's been amazing what we are learning with Pan-African News. August is such a pivotal month for Black people globally. So I am happy that the team is lifting up what is going on in August and what is going on with our news. Go ahead, because I'm taking it you off of mute now.
Well, you know what, I thought I'd just join in with you and support you in the effort of introduction to our community for this great day as we discuss infant and maternal health, primarily Black infant and maternal health, and then what we're doing for women of color, and what not only have you with Black Women for Wellness at the helm of the leadership for the past 25, 26 years. I don't even want to date us. I thought about that when we were playing the song by Beyonce, You Won't Break My Soul. And I said, this reminds me of house music in the 90s when we used to cut up. And I said, I don't want to tell everybody that, because they're going to know. They're going to know. They're going to know. They're going to know, like you saw that gray hair and you got super shocked on Saturday to see those grays in my hair. I said, this woman about to lose her mind. But
it was quite surprising. I was like, whoa, what's that gray in your hair? Like, I'm not looking in the mirror in my hair. I think we're ageless.
Right, but I'm grateful. I'm grateful for sheroes like you being the vanguard for our community. Since we met when I was just coming out of college, and since we met in the work at Black Infant Health Program, Great Beginnings for Black Babies, Inglewood Healthy Mothers and Babies, and how after that you saw the need, you and 6 other sisters, 6 other queens saw the need to ensure that Black women had an opportunity to experience great health services and resources, right? And
I just want to give a shout out one more time to Catherine Halter-Hilo, because she was the person who said, come on, sisters, we got something to do in Los Angeles, and started their very first birthing project, Baby Bunch, here. And those were the women who we started it with, right? It was Akula Jitahadi, it was Shaquestra Satawi, it was Moya Fune, it was Indoni, and it was Claudie, who really stepped up to the table. And that's where we began with that birthing project bunch.
And Queen Adjoa, the late Queen
Adjoa was oh my gosh. People are, like all these mentors and cheerleaders and coaches that I had are aging also. But yeah, I remember she passed, and then Emerald passed, but I just did want to give that shout out to Catherine Halter-Hilo, because she joined us last Tuesday and really talked about how she's general in this battle for human rights, and to lift up Black women and birthing people, because she's been doing it longer than we have. And she's doing it worldwide at this point. So I appreciate that we are able to bring voices that open doors and started that path for us also, as well as those ones who are like on it now.
Exciting, super exciting, super exciting. So listen, thank you, Jan, for getting us started and the welcome, and we're going to bring you back. You all stay tuned and stay seated or stay standing or whatever you're doing in this moment to participate in this conference. You will not want to miss.
Connected.
Listen, Jan and I will be back at the end about 11:35 or so, and you will get to experience, I'm just saying, 2 Black women with opinions. So hold on to your seatbelts, get back, sit back, relax, and enjoy the ride. We're about to begin our first panel, More Than Band-Aid Solutions, Infant and Maternal Health Policy. So again, thank you, Jan, for making sure we had this platform. So at this time, I'm going to invite up to this podium some of our speakers. Let me see how I find them and bring them up here to join with me and spotlight these beautiful ladies on today. Gotta figure out how to do this. We got a multi-pin, folks. I know how to do it, but today is proving to be interesting. So I'm going to ask, if our tech team can help to multi-pin and add into the screen Anyema Obiaka, Morgan White, Kyrish, and I'm going to have Kyrish pronounce her name because I do not want to butcher it, as well as Elizabeth Simmons. And I will begin by introducing these great queens, these sheroes who are doing fabulous, unbelievable work in this field. All right, we got just one left. So I'm going to start with Anyema and let you all know just a little bit about this queen whom I just love so dearly. She's like a little sister to me, and I truly love and appreciate her and all the work she's doing. Anyema began her work in reproductive justice as a program coordinator for BWW's Get Smart Before You Get Sexy program, the comprehensive sex and sexuality education program of the organization's RJ-focused project, Sisters in Control. Since then, she has continued her work in RJ in varying capacities and currently works on behalf of the BWW, Black Women for Wellness Action Project, to advance intersectional, transformative legislation that seeks to secure the health and well-being of Black women and girls throughout California. Anyema holds a Juris Doctor from the Northeastern University School of Law and a Master's of Public Health from Tufts University School of Medicine. She is committed to contributing to the global realization of reproductive justice by leveraging her training and experience in the field. You all give and help me welcome Anyema Obiaka to the stage. Thank you so much for being here, Anyema. Next up, let me get this right, is Morgan White. Ooh, baby. I have to get this together. I have to read all this. Morgan is the director of the Birth Equity Advocacy Project. Previously, Morgan spent over a decade working at various levels of government, working for the offices of the late U.S. Representative Congressman John Lewis. We're getting into some good trouble today. U.S. Senator Kamala D. Harris, now our VP, former U.S. Senator, current VP Kamala D. Harris, Atlanta City Councilwoman Yolanda Adrian, and a number of campaigns and political party operations throughout Georgia, North Carolina, and California. Prior to that, she served on the board of directors for Citizen Advocacy, a nonprofit that has for the last 30 years advocated for people with developmental and physical disabilities. She currently sits on the board of FAM, the Foundation for the Advancement of Midwifery and Healing Hands, a Community Doula Project. Morgan's experiences in the U.S. House of Representatives and in the U.S. Senate focus heavily on civil rights, economic development, and homeland security, as well as women and children's rights. Additional legislative experience includes federal state program coordination, transportation, and infrastructure legislation, as well as socially responsible policy implementation. Accompanying her experience in state government, she has assisted local governments in successfully securing economically beneficial contracts, along with fostering community beneficial relationships with local orgs and the city. Most recently, Morgan was a part of the historic legislative deal in California that increased medical malpractice. Y'all need to hear about this one. Medical malpractice caps for the first time in 50 years by advocating for the needs of families of color. Morgan is a 2010 graduate of Hampton University. Okay. She earned her a BA in political science. She is trained by the UN Corporate Social Responsibility and Business Human Rights. She is a native of Atlanta, Georgia, and currently resides in LA, California. You know, we are happy to have you here, Morgan, representing and coming all the way to California with your great expertise. Welcome to the stage, Morgan White. I so appreciate this young queen and so excited to be working with her. Next up, okay, these next two queens, you know, if you're a doula, even if you're a midwife, these two are fighting behind the scenes and up front to ensure that women, especially women of color, have the services that they need as doulas. And so, you know, as services that are needed by doulas, but advocating for the doula practice. And so I'm excited to, Kairos, come off mute real quick and say your last name for me because I got to get it right.
Chiaji.
Chiaji, okay, I wanted to make sure I had it right. Kairos Chiaji, owner of Braids, Bits, and Babies, is on a mission to lower infant and maternal mortality and morbidity in the African American community by increasing the number of culturally competent birth workers, helping them grow their businesses in the field, and mentoring them in civic engagement. Braids, Bits, Beads, and Babies, and other beatitude services is a sole proprietorship umbrella for a number of businesses, including catering, jewelry sales, and natural hair art. It affords Kairos the flexibility to pursue her passion. Baby got backup birth support services. I love it. As a professional and community doula herself, she also provides birth support, education, and advocacy for birthing families. Kairos began her practice as a birth coach in 1999 in Sacramento and continues to serve Northern California. She and her global cohorts know this humble and hard work saves lives. Her motto, there are millions of unplanned pregnancies, but there never has to be an unplanned birth. Kairos also has the honor of being the national trainer for doulas seeking the Birthing Project USA certification and currently serves on the BPUSA Board of Directors. She is also a foundation board member elect for the Sacramento Black Chamber of Commerce for the 2021 through 2024 term. And because fun and self-care are necessary, Kairos makes time for daily training with her horses, Namib and Naisi, usually in heels. That's why you see up there, doula in heels. Kairos ain't playing with y'all. Welcome, Kairos, to the stage. I'm so excited. And when she had those beatitudes in there, I said, beatitudes? Okay, come on, Lord. I'm here for it all, representing my sister. So I'm so excited Kairos can join us. And last but certainly not least, this last sister who I'm excited to bring up is another one of our allies, partners, and queens in the work, Elizabeth Simmons, who's a birth doula, founder, and CEO. Elizabeth began her career in maternal health as a birth doula in 2007. So she ain't new to this, she's true to this. You know, there's a difference when folks are new to this, but you know, some people have been true to this. Right after finishing her doula training, Elizabeth began to wonder and dream about being reimbursed by insurance companies. Unbeknownst to Elizabeth, she was planting a seed that she would harvest in years to come. She opened a freestanding birth center in Boulder, Colorado in 2014 that is now an integrated facility within the community hospital system. She served as the industry relations chair for the American Association of Birth Centers and has spent the last 13 years of her career dedicated to building networks and partnerships with health plans to support perinatal health. In 2019, Elizabeth harvested the seed by launching the Doula Network to create a foundational system of doula services. Elizabeth's dream is for community doulas to be fully recognized, appreciated, and valued members of the birthing person's care team. Without further ado, let's welcome and thank Sister Queen Elizabeth for being present here with us on today. Thank you all, ladies. So before we get started, I want to play this video. I'm hoping I can share my screen appropriately. And so we're going to go in this order for all of you who are present. Anyema is going to start off first. I'm super excited. You guys, now you're talking about sheroes. These four women, as you can tell just by a little bit of their history that I shared, that you're going to be in for a real treat. Anyema will go up first, and then we'll have Kyrus and Elizabeth, and then Morgan will follow up in the rear. So I want to share this video on a film that is upcoming entitled Birthing Justice. Hold on one second. I hope you all can see my screen. Press play. Let me know if you can't hear the sound. When African Americans are centered in policymaking, it affects everyone. Fear, anger, shame, othering, being ignored, being lied to, being dismissed, being discriminated against, being fundamentally disrespected should not be anywhere near this. And you can have joy and justice together. That is possible. We're talking about changing culture. And I know that within our healthcare system, joy is not necessarily a foundational premise in every healthcare system in this country, on every birthing unit in this country. And so I'm okay with creating a caucus and legislation and a safe place to say, so this is what we're about, is bringing joy.
One thing I probably haven't said enough of is like, listen to Black women in leadership, listen to Black women who are in these communities who are telling you, listen, and we will tell you what we need. And I feel like there's also been such a movement now for Black-led organizations to also push to be like, hey, we just got to do this ourselves. We got to take care of ourselves. And I'm excited. Like, I have, in the last 5 years, gained so many different colleagues in the fight, in the movement. I just feel like that's even such a shift, but I'm optimistic.
It brings me joy every time we have positive birth stories. Those moments bring me so much joy, and they're little nuggets sometimes, but they're so huge.
You not find it? Did you check any of your relevant?
All right, thank you. Anyema, we're gonna bring you up and we'll all just step back for a minute and allow you to lead us out.
Hi, thank you so much, Ms. Adjoa. It is just such a pleasure to share space with all of these phenomenal human beings on this call today. So I really do look forward to our conversation moving forward. I do apologize in advance. I don't have a PowerPoint presentation, so I do encourage folks, if you have any questions, to please feel free to ask. And I'm happy to answer any questions directed at me that may not have been clear. But and if everyone could just make sure that they are muted. I know this technology is is something serious. I'm shocked that I'm even able to unmute and y'all can hear me. But my name is Onyema Obiakia, and I'm the policy analyst for Black Women for Wellness and Black Women for Wellness Action Project. And so I've had, the great honor of doing the work and supporting the work to shepherd BWW's co-sponsored bills or legislation through the legislative process. And honestly, with the leadership of Norbese and, the vision of this great organization, Black Women for Wellness has enjoyed tremendous wins and made really incredible strides to advance maternal health policy, and maternal health policy that really centers the lives and the experiences of Black birthing people. And so, California has made tremendous strides in, addressing and reducing its maternal mortality rates just overall. So in response to, what was an upward trend of maternal mortality in the country and in California between about 1999 and 2006, the California Department of Public Health launched the California Pregnancy Associated Mortality Review Committee to identify the pregnancy-related deaths, causation, contributing factors, and sort of make recommendations as to the quality. So as a result, since 2006, California really has seen a decline in maternal mortality or maternal pregnancy-related deaths by 55%. And that was between 2006 and 2013. But, although California has reduced the rates of maternal deaths over the past 30 years, mortality, pregnancy-related death and morbidity, like severe injury, right? Injury that is so severe that it may have it was an experience that resulted in near death, but not the death of the pregnant person. So mortality and morbidity for Black and Indigenous folks, remain considerably higher than the state's average, right? And we know, research, right, continues to come out and has in fact established that structural racism, implicit bias, socioeconomic factors, contribute to the racial and sort of geographic disparities that we see in birthing outcomes in people of color. At the end of last year, I believe, gosh, what is time these days? A report came out that actually noted that Black birthing people in California are actually 4 to 6 times more likely to die from pregnancy-related causes than our counterparts, right? That is staggering. That is really, really disheartening. And I mean, it confirms what we know. It confirms what we on the ground have been seeing. And so, what Black Women for Wellness does is it sponsors legislation as a way to enact systemic change such that we can have, long-term, broad, impactful change that, will really meaningfully address the egregious disparities that we're seeing in maternal health outcomes. And so what does that look like, right? Over the past, we've been taking an approach that, each bill that we sponsor addresses a component that has been identified as impacting or negatively affecting maternal health outcomes, right? And we offer a solution to sort of remedy that component, right? So countless amounts of research has identified implicit bias as a root cause of the maternal mortality rates, right? The disparity and the disproportionately high rates for Black birthing people and Indigenous folks, right? And so what do we do about that? One way that we sought to address that was through one of our bills, SB 464, the Dignity in Pregnancy and Childbirth Act. And that bill was, it was passed, shout out to then state senator, now Board of Supervisors, LA County Board of Supervisor Chair Holly Mitchell, who authored that bill and who's a champion for that bill. What that sought to do was, what it did actually, it's now been signed into law. What that did was mandate implicit bias trainings, and not just any implicit bias training. It mandated implicit bias trainings out, like with that had to have certain requirements that were sort of enumerated in the bill, for any perinatal provider throughout the state. And this training they had to take every 2 years, right? Or they have to take every 2 years. So you have this rigorous implicit bias training, right? It's not the way the law envisions it. It's not just some 1-hour course that someone sits through. It's supposed to really be rigorous and engage perinatal providers who are in the perinatal workforce, to really grapple with and get an understanding of what their implicit biases are, such that, that can translate into the care that they provide. Another thing that's beautiful about what this bill does is that it also empowers patients, right, to understand with their rights, education around their rights around how to file grievances, when they feel as though they weren't properly cared for, and it was due to implicit bias. So we have a bill currently that's been signed into law. It was signed into law in 2019 and took effect in 2020, right? And so one can imagine it took effect as, the pandemic first struck. And so, we are now looking at implementation and how to implement this bill as it was originally envisioned. Other bills that Black Women for Wellness has co-sponsored, is of course a bill that so that was SB 464 that we talked about. SB 65, that is the California Momnibus. That is, and it's Momnibus is a play on omnibus, right? And it's the state version, it's the California state version of what has been trying to be passed on the federal level. And it's a bill with several different components, all looking to address the various causes of maternal and infant mortality, out of which a significant component of that is actually securing doula benefits as a doula services as a Medi-Cal benefit, which it's so wonderful to have Ms. Kairos here and Elizabeth here, as I'm sure perhaps they'll touch on this piece. And while it has been a challenge, it's monumental in that it ensures that folks who have Medi-Cal, right, can have access to a critical service that has been proven and has been shown to result in positive birthing outcomes, right? That's the goal of this work. And so, among other things, there's a guaranteed income program included in the California Momnibus bill. There are it prescribes a way to better collect data so that we are, that includes both maternal mortality or pregnancy-related deaths, as well as morbidity. So we can actually look at, okay, we may not have captured folks who didn't die, right? Because they didn't die, but what happens to the folks who were near death? Like, how are we collecting data on them? Because just because they didn't die doesn't mean they didn't endure severe harm that's not only traumatic, right, but has lasting impacts on the birthing person and potentially their infant. And so it really looks to see how we collect data on birthing outcomes of birthing people. Let's see. So SB 65, was signed into law just last year. It was monumental, and so right now we're looking at ensuring that all of the components of the bill are fully funded and ensuring that it's implemented as envisioned, which is a separate struggle, right? But first we pass the policy, good work begets more work. And so we're fighting to ensure that the bill is implemented in a way that's just and actually results in what Representative Underwood was talking about. This is our goal, right? These joyous, so that birthing people, Black mamas can have these joyous birthing outcomes. We're also, so those are some bills. We've also worked on bills that expand access to care to birth workers, both nurse midwives, particularly nurse midwives, by removing physician supervision that allows them to work in rural areas that don't have access to an OBGYN. At least 9 counties in California do not have an OBGYN in that area. So having nurse midwives who can actually provide that care and fill in those gaps is critical. And so we've also passed legislation to do that. Currently, California Black Women for Wellness is co-sponsoring 2 bills in this legislative cycle that address that further, help to address the maternal mortality crisis, because you can't achieve everything in one fell swoop. The California Momnibus moved the needle forward by many, many meters, right? And that was phenomenal because folks were like, you can't get everything that you're asking for in one bill. And I feel like Nurbese and the Momnibus Coalition was like, hold my beer, sangria, margarita, orange and beet juice, whatever, hold it and watch me work. And we were able to win this significant thing. But there's still more work to be done, right? Like there's so many aspects to ensuring that maternal mortality is in fact resolved, the issue is resolved. And so this year, we're working on expanding access to doula care such that even if you don't qualify for Medi-Cal, you might not qualify because you make just over the threshold, right? But you still want access to doula care. Well, here's an opportunity to have that. We're working on that. We're working to secure doula care for incarcerated people in California, right? And that's our current bill, AB 2199. We also have another bill that seeks to address the housing crisis, and ensure that pregnant and birthing people who are on CalWorks have the resources they need to ensure that they have stable housing and are referred to home visiting programs and other programs to support them in having safe and joyous birthing outcomes. And so that is authored by Senator Skinner, and that is SB 1083. I'm sure I may have missed a few things in this, but I will yield. And if folks have questions either about the bill, we can make a list of the bills that I talked about actually available on like a one-pager, just so you can get a quick overview of what the bills do and their status in the legislature if they're moving forward in this session. And if you have questions around how to ensure, how to support, how to get involved, two of our maternal health bills, the two bills that we're actually co-sponsoring this session, just made it off last week, just made it off of suspense and are headed to the floor of their respective houses. And so we will need, because our bills are expensive and folks are looking at like funding as a reason to perhaps not advance our bills this time. We need the community to say, no, this is an investment worth making. So let's pass these bills. Let's find the money to fund these bills and fund this work such that Black mamas and birthing people are not dying, right? Because of a racist system. So please check in with me, plug in. We will be tweeting, we will be sending letters of support such that these bills make it off of the floor and get signed into law by the governor. So if you have questions, I'm happy to answer any questions that folks may have. Thank you very much. And I will yield to Ms. Adjoa.
Thank you so much, Anyema. I was behind the scenes working it out on behalf of you to add in some of the information so people have the sign on and they have a good summary of the bills. So and then they can gain more information. You can give the fact sheets and we'll make sure they're posted up for others to see. So again, thank you. And we'll come back with questions and answers at the end. So what we'll do now is bring up, and if folks can monitor those questions, and I'll try to make sure that we monitor them. If folks can bring up Kairos and Miss Elizabeth, they're going to be up next for conversation. So again, thank you, Anyema, for a great update on the policy. We're super excited of all the work that Black Women for Wellness has put in for us for the last, especially the last really 5 years around Black infant and maternal health policy that really impacts all in our community around pregnancy and birthing. So again, thank you so much for sharing that. Many of us went to lobby visits for SB 464 and have supported SB 65 and now are supporting the two you mentioned, AB 2199 and SB 1083. So again, thank you. All right, we'll remove that spotlight and you can pin these two queens. Thank you. It's on you.
Oh, thanks, everybody. Kairos, are you up here too? I'm not sure I can see what's happening.
I'm here.
Okay, good. I don't want to go without you. Thanks, everybody. And this is unreal. This group, I mean, Kairos, chime in whenever you want, but I'm blown away by who everyone is in this room and all the work that they've done. And really, I want to be really transparent. I'm here because of a larger effort that's being made by so many community-based doulas that have their feet in California. Kairos is an example of one of them. And really, they were like, hey, Elizabeth, do you have time to put this slide deck together to share with everybody the amazing work we're doing? And I said, yes. So please know that we are sharing the work of many, many others today. Kairos and I are the spokespeople for a larger group. We are not the ones who've done it all. So Kairos, I'll share, we have a couple slides to share. I do want to warn you that if you are not at all familiar with the doula Medi-Cal benefit, this is going to be a lot of information pretty quickly, and you can feel free to reach out to either Kairos or National Health Law for more info. And I also want to give a shout out to National Health Law and the amazing Alexis Robles-Fredet, who really pulled these slides together for us. So let me see. Okay, so just quickly want to give a little bit of background on the National Health Law's Doula Medicaid project. They work across the United States. The team that we work with, which is Amy Chen and Alexis, are both based in the Los Angeles area, but really they're working across the United States, tracking what's happening with doulas and Medicaid. So we have a real quick call to action already to start a presentation with. If you are not already on the California Doula listserv, please email Alexis. Her email's right here. I'll put it in the chat to email her, get on that list. It is a powerful list of everything that's happening and the most recent twists and turns. So you'll want to be there. If you happen to be listening from outside California or even California, you want to learn more, go to their website. They track everything doula and Medicaid. They're just an amazing group. So please go check them out. So really quickly, I was going to start with the California timeline. Kairos, do you want to do the timeline or do you want me to do it? I mean, I'm up for whatever.
You jump in.
Okay, I was afraid of that. Okay. So just so you know, this is a perfect example. What we're talking about today is an example of all of the work that fierce queens like Onamaya have been doing in the background for so long, because this benefit started in SB 65. It was in the California Omnibus, and then it got moved to the budget. So without the work, I mean, I just can't say enough. There are so many people who are working behind the scenes that you do not see. And it is those women that have moved this forward. And so we're going to call out some of them specifically. Hopefully they're here so they can be a little bit embarrassed, but I mean, they're not. So it started in June of 2021. The doula care was included in the state budget. It was a little bit dicey when it was first included. It was included at a much lower rate than it's going to be reimbursed at, which is still a rate that is too low, but the current rate is double what the initial rate was, but still too low. The original start date was January 1st, 2022, and then it was pushed back to July and then pushed back to January 1. The one comment I want to make about that is that was honestly the most brilliant thing that the doula stakeholder group, which was convened by DHES, did. There's a lot of amazing things that this group, and we'll call out the individual community, the communications work group and the larger work group on additional slides. But from an outside point of view, it might look like, oh, it got delayed. That's a bummer, but it actually was what we wanted, because California was like a snowball rolling downhill with this benefit. And these community doulas really said, you need to pump the brakes. Like, this cannot be another example of a legislative effort to create solutions that actually creates harm. And honestly, it was headed, right, Kairos? I mean, we were like chugging straight towards like the cliff of serious harm to doulas and then to families as a result. So we were, one of the requests of the group was to slow it down. So we're really excited that we got a year to meet with DHCS and to really do the work to get it going. So basically where we are right now is they're about DHCS, which is, California Medicaid is about to submit the state plan amendment to the Centers for Medicare and Medicaid, which is our federal version. Once that's done, it should be approved. There's a million steps in there. And if you want to be involved, we would love for you to be involved. We have work group meetings coming up. They're right here. Everyone's welcome to go. If you're like, how do I get involved? Email Alexis. She will put you on the listserv. The listserv comes out, remind you of when the meetings are. Harris, do you want to add anything to this one?
Just know these dates are just a sprinkle, like sprinkles on a cupcake. There were so many meetings and so many really hard conversations, and a learning curve as far as communication, and just trying to merge what equates to, government and bureaucracy with community-based service. It is a marriage made in a 12-step program. Like it was really, it required that we bring our best selves and keep pushing and not let frustrations and what felt like delays be the thing that made us give up. So basically a lot of this has been a prodromal labor, but we are moving forward little bit by little bit.
Yeah, that is the perfect way to look at this. It was a lot. There was, just to be transparent, there was a lot of harm done initially. And so one of the wonderful things about the delay was it actually enabled us to have time to directly address that harm and correct it. And I can't say that DHCS has really, they keep showing up. Is this perfect? No, but they've really done, we've pushed them way outside of their comfort zone, bringing our tears and our emotion and our advocacy and all the things that actually need to be in this benefit to the table every time. So when we talk about the benefit, we have to bring up this group. So there's been a work group created, a communications work group. It's a smaller work group. Here are our members. It's Paisha Edwards, Linda Jones, Samsara Morgan, Saida Pepper Wilson, and Kefri Riley. If you know any of these women in person, you should go hug them. And if you don't, maybe just send them a nice note via social media, because without these 5, we would not have gotten to where we are today. They really dug in. They met monthly with these DHCS to dig in with a mediator and a facilitator to really address the communications. As Kyra said, that communication pathway was dicey for a while. They worked really, really hard. They also spent a lot of time meeting with other states and other community doula organizations and talking to Oregon and Rhode Island and New Jersey and Florida to create a really great benefit for California. I think when you include the communications work group and our larger work group, there's been thousands and thousands of hours of work done. And it's an area that's endlessly frustrating to me, and that those who are making this benefit, the state Medicaid, they're not showing up to meetings without being paid. But there is an assumption that our sisters in the community are okay with it. And that has been really frustrating. So there has been the ability to receive some funding, but there's been no pay as of yet for these comms team members who've taken what the rest of us have done and kind of doubled the amount of time. And so if anybody on here is going to get involved in other states and the work that's done, we need to start, as doulas, we need to start pushing for our time to be respected. And when you're the expert, you shouldn't be working for free. And this state benefit has pushed, when you say Kairos, a lot of us really close to the edge of that, free work.
Yeah, it's really sort of an example of how birth work is undervalued, period, right? The fact that this takes this much work and that there's pushback. Why would there be pushback against anything that saves lives, literally? But in this same way, this is just sort of a microcosm of how systems view community impact. So
Yeah, it reminds me, the other day we were on a call and there was this really small point that needed clarification. I mean, honestly, like the smallest thing. And there was all this pushback, and Samsara Morgan actually got on the call and was just like, can we just center this on the fact that women are dying? And we were like, but it's so harmful that we have to bring it up, that we have to keep reminding the people who are in charge, who control the levers of access and finances, that this matters, that our bodies matter, that our children matter, that our communities matter. It can be frustrating, and hopefully in the end, the wins will outweigh those frustrations. But I'm not saying, I know that sounds a little negative, but I also just want to be honest that it's been, when this benefit gets rolling, I think there will be a lot of people who will be excited about it. And then there will be some of us who are like, I'm going to need a nap. And one of those margaritas, sangrias, whatever, all of those things that Onyemai was mentioning earlier. And so we wanted to provide you just like a one screen that really goes over the benefit in case you've not been involved or you didn't know. I would say the coolest thing, so my work, I work in a lot of different states doing this doula work. And the coolest thing that California has done is California, these doulas the community workers in this area have changed how doulas are seen in the Medicaid realm. So if we can just take 1 second to like flash back to like the 1940s and 50s, when we took birthing privileges away from granny midwives, ancestor midwives, sisters, home birth attendants, and we moved it into a white, male, patriarchal, hierarchical, hospital-based system. In the damage that was done in that moment, how much we lost, how much we're still fighting to get that back. What these doulas did in these groups is that they were able to see that and say, not again. So in California, you're going to be able to be a doula whether you're trained or you're experienced. So Californians are not going to lose the generational, ancestral community knowledge. And it makes me kind of cry because I'm so excited that because I think that this work is going to ripple across the United States and say, no, no more are we going to say that. I know that we're going to judge a community for having wisdom. We're going to say you have it. Let's keep it inside. So having said that, this is kind of what those two pathways look like. This is a really high level look at it. There's a lot more details in the state plan amendment. There's going to be a provider manual coming out. We don't have all day, or we could talk about it all day, but I just wanted to really highlight it, that specifically the work of the women on the slide before really pushed for this experience pathway, and it's going to change doula services in California.
The one thing that was critical was that this giant win of legislation did not create barriers for those of us who have already been out there doing this work. And without a whole lot of pushback and reminders, just stripping off blinders, really, it would not have, it would have been exactly that. And so people who love and work within and are a part of the communities that need this support continue to be able to do this and now be valued from a standpoint of being able to bill Medicaid for that work. And not that there won't be a whole lot of hoops still to jump through. It's new. They're trying to figure it out. We're asking questions and they're, the answers aren't there yet. The answers don't exist yet. Or if they do, the folks we're asking don't quite know yet. But just rest assured, we are continuing to push, continuing to look out for the folks that are doing the work, because doulas need doulas. And for folks and supporters and all of that. And so this is really a way to legislate valuing of those folks. And that is historic. That has not happened in this way. And so we are doing our best to with this big cookie, as little crumbs break off in the exchanges and the clashes, we're grabbing them and throwing them back on the table. We're throwing them back on the table and throwing them back on the table. So there's still much work to be done, but understand this is not as simple as a one sheet on a PowerPoint makes it seem. Like we literally had to argue the value of the work and the fact that you cannot quantify it. You cannot quantify experience and in a certificate, in a training certificate. That is not the thing that makes this work.
Yeah. I mean, it's so big. I know when we crossed this threshold, there was so much joy in the room. And Kairos, I know you're a huge part of that. The voices, the willingness of community doulas to step forward in this process and to put their voices and their experience on the line has been huge. I know. One other thing to add is that this benefit will be covering abortion services, which in our current climate is enormous. You know, and so it's going to be really, it's miscarriage and abortion services, so both, but being able to truly provide the services that a doula needs to do for their community. It's been a really exciting time. So there's Kairos with her horse looking really cute. So let's all just take a moment to look at that because it's joyous. Lastly, I do want to call out Alexis. I'm sure she does not appreciate it as much as I'm calling her out, but I do, because she really gave us all the stats. So with that, I'm willing to yield the floor, and our contact info is on here. We can throw it in the chat. Please reach out. This is, and thank you so much, everybody at Black Women for Wellness, for including us in today's festivities. This has been amazing.
Thank you so much, Elizabeth and Kairos. You guys have both been amazing. We will definitely bring you back for a Q&A because folks have comments. They're sharing how it's a great win, and thank you. So we're super excited for the work that you've been doing and very appreciative of your continued efforts. So we'll be back. I'm going to bring Morgan up to the stage, and then we'll continue on. Again, thank you. Everybody, I hope you've been enjoying this thus far. I know I have. It's a lot of information to take in, so I hope you're taking notes. And just sit back, continue to listen in, continue to check in with one another, continue to make new friends, reconnect with old friends, and then get ready for Sister Morgan. Morgan, let me know when you want me to pull up what you shared.
Oh, you can pull it up now.
Okay, all right, give me a second.
I think maybe the second slide is probably more impactful because it has more than just a photo. It has a photo and information, if that helps. Well, I just want to say thank you so much for giving me the space. I'm such a huge fan of Black Women for Wellness and all the work that they have done and continue to do in every space they can get into. And thank you. So it's so awesome to just be in this platform because I've been taking notes like this whole time while also trying to remember that at one point Adja was going to call me to talk because it's just such great info. But I am really, really, again, honored to be here. I'm really excited to share with everyone why this is so important, why policy is such a big deal. I'm sorry the words are so small, so if you can't read them, I totally get it. I'm gonna give everyone a background, but I'm a director of Birth Equity Advocacy Project, and we became a 501c4 by design because we wanted to come into this space and really fit into the ecosystem in the most effective and efficient way. And for us, that really looked like amplifying the work that is already being done, that's been being done by these birth work warriors, and really just being more present in the space of lobbying, because I think, and I'm sure a lot of people will agree, it's hard to see Black women lobbyists, let alone Black maternal care lobbyists or lobbyists for birth equity. And that's not surprising because, as we know, the hospital system and everything that is in that has been rooted in institutionalized racism. So, fighting against it isn't something that people are wildly going to support. But we're very happy to be in this role in the space because it gives us the ability to, as I like to describe us as the angry Obama from Key and Peele of the space, we just like to be unapologetic and absolutely just relentless when it comes to advocating for Black infants and babies and moms. So with that, I will just share that a really big part of our work is advocating through human rights, and it's doing it with, with the idea that through the lens of human rights, but with the idea that these laws, these policies, this system, it was not designed for us. It was never written to benefit Black women and especially Black people. And so that is why we really take to task lobbying and digging into all of the policy issues and barriers that we know are going to disproportionately affect us and our families more than everyone else. And so it wasn't hard for us to jump into this space and for this issue for that reason. As my former boss would say, Congressman Lewis, one of the best things I learned from him, aside from working with him, was, and he would say this very often, everyone has a role in the movement. In the civil rights movement, that looked very different. You could be in the streets marching and protesting, or you could be, organizing, or you could be helping in the churches. Everyone had a different role, but it didn't mean that anyone's role was less important, less significant, or not as righteous as the latter. And so we knew that this issue, as I'm sure a lot of people understand, is going to take a multi-pronged approach. And with that, we felt confident that leaning into this space through this avenue was a lot of the barriers that, again, mainly affect Black women and families. So with that, I know everyone can see this photo. If you're not familiar with this photo or this story, I'll give you a very quick background. This is Kira Johnson. That is her little baby, and that's her first son. And the reason why Kira is up on this and why she's the inspiration for why we got behind this issue is because Kira and her husband, Charles, were just like every other young Black family that was just trying to do right. They wanted to, after their first kid, they went through about 10, 15 different doctors. And their story is a tragic one, but it's a great example of how the system absolutely failed them at every single level. And from the moment they got their doctor could not actually perform C-sections, although he recommended one. His dexterity was not up to par and had been outsourcing C-sections for a number of years. And California didn't know he was doing this and therefore couldn't really stop him, right? As a result, the doctor that delivered Kira's son was actually under investigation for 5 other negligently performed C-sections in the state when he performed Kira's C-section. And because it was her second child, that takes more time to cut through. And he ended up doing it in about 2 to 3 minutes. And if you work in this space, you know that that's just absolutely insane. And on top of that, when Kira's husband recognized that she was in pain and that there was blood in her catheter right after giving birth, they were ignored for 10 hours. And this is at Cedars-Sinai in Los Angeles. And if you go on YouTube, you can find Charles's story, and he is a fierce advocate for his family and his wife, but more importantly for Black moms and babies that do not have the platform that he was very, very blessed with. And so just going off of the trickle down effect of what happened to Kira, and to give you a little more context as my background and why we looked into it this way. When I worked in government, we take calls from constituents, we take calls from everybody under the sun, given the amount of the population. California has about 40 million people. And so when we get a call from someone about an issue or a specific problem that is either regionally based or issue based, we have to look at it as a numbers game. So if 1 or 2 women call about the certain issue, we have to go ahead and assume that that's about 2,000 women that don't have access to us or know they can call us about this issue. And we then have to address the issue with that kind of urgency and priority. So taking that experience and that knowledge into this space, it was very easy to see, not only, we know the statistics, right? We know that this maternal mortality exists beyond socioeconomic status, beyond class, beyond race, beyond everything but race. So you can go to Harvard and they don't care. You will still be on that table fighting for your life, and they will still ignore you. You can be a Black OBGYN and they will still tell you that you were wrong about your own body and expertise. And so what we knew in Kira's story was far more grave than what probably a lot of other people can see, which is that there are so many Black women that are having this exact same experience, but they don't have a partner to fight for them. They don't have anyone to listen to them, or they don't make it to continue to fight for themselves. And so that's the real fight, the real pain that we saw in this unfortunate narrative, because we knew that it was just happening a lot more, and there just wasn't enough talk and conversation about it, or women didn't realize that they were not alone in what they experienced. And that's why we really took on this fight. We also recognize the fact that Charles and Kira's story was so evident of what Black families are experiencing across the country in states that have medical malpractice caps, which is mainly injuries that pertain to women, reproductive injuries, injuries that affect women across the spectrum, were written in a way, these medical malpractice laws were written in a way to not allow them real accountability and justice. So when Onyema was talking about morbidity, that's the meat and bones of what this really protects. It's the fact that not every woman is going to die like Kira, God forbid, but they are probably going to experience a range of things that can exist on the spectrum of morbidity. And that is when we talk about, quality of life, life-sustaining, life-affecting changes to your quality of life because of injuries that were incurred through negligence. And so that's one framework, right, of issue. But the other one is, thank you, Adjoa. The other one is that we were seeing that Black families, low-income families, were not even able to get an attorney. And so just to sum it up all in one package, really, it was not just one side of this that was problematic. It was all sides of what this looked like for justice when it comes to Black families. When California is going to say Black women are 4 to 6 times more likely to die in childbirth, we believe that they should have a better path to justice. And we believe there should be a better path to accountability. And there shouldn't be laws that don't ensure that, and ensure that for the most vulnerable people in the population, which is Black women. So again, I'm so happy to be here and have shared this with you guys. It was a very challenging battle because there's a lot of people in this world that are trying to do great things. And quite often in policy, especially when it comes to Black people, they make us pick and choose. They never get they never really give us everything at the same time. And so we knew that in this fight, we wanted to just do our part and be as loud as we could so that people understood that, at every point in this time, especially as we're most socially aware and we're all social justice advocates and we're passing all this great policy on the state and federal level, that we're meeting Black women where they are when it comes to justice. And we, to sum it all up, there are so many laws that are written to regulate our bodies, to tell us no, that policy-wise are meant to control us. And so we just felt like it was about time we undo that, right? And make it so these laws work for us and are written for us, get some on the books, right? With everything else. But I'm very happy to have done it. The next battle is on the horizon. So we're just staying in the fight. And, with everyone on this call, we are always here to be supportive to people doing this great work. And so even as a 501c4, please always reach out to us. Please don't ever hesitate to let us know how we can support you, how we can advocate for you as well, and the bills that you are advocating for and supporting. Thank you so much, Adjoa. I will yield to you the floor.
No, thank you so much, Morgan. You made some very valuable points. I think back to one, when you came into some of our work within the African American Infant and Maternal Mortality Community Action Team, and how you joined our policy and advocacy work group. But even more so, just finally meeting you in person that day when Charles was at Cedars-Sinai and making his, where they had the actual, news conference, and sharing that he was going to be filing a civil rights lawsuit against Cedars-Sinai for the egregious act against his wife, where that her particular C-section in and of itself was about 17 minutes in total. And then what did not happen thereafter. So again, super happy because now I, get to not only put a name with a face, but really get to see the work that you have and been doing for us across the nation, and now especially in our community in California. This whole medical cap is, it's super powerful, because many of us don't know what we sign away when we go in, especially for emergency visits and whatnot. We basically signed away the right to, go, file a lawsuit. We have to either, mediate and things of that nature. And generally it's not on our behalf. I'm going to bring the other sisters up to the platform. But again, I thank you for what you have shared too. Let's see, someone help me with the multi-pen here. Okay, let's see. All right, got it. Let's see, find Anyema. Hopefully she can come back. So again, we have a few questions that folks have asked, and I'm gonna go through and, no, what happened? Something, okay. All right, cool. Now we're all here together. Okay, perfect. I saw a few questions in the chat, and then I went into my documents. So there were some questions. I know Neoma had asked a question a while back, and this is why we made it. We wanted to make it a Zoom and not particularly a webinar, because it gives folks an opportunity to really be able to respond. I think Neoma asked a question, just wondering if the link to the doula listserv can be placed in the chat. So that was one question. She also asked, not sure if this was addressed, are there any provisions to classify doulas as essential healthcare workers, essential members of the team, especially when hospital shutdown policies are enacted? They're the first to be cut. Yes, we all saw that and experienced that. Elizabeth or Kairos, you want to answer that?
So I actually asked a similar question when we were in the meetings, because it was like, if you're a care provider, can they decide that you're not able to go in? In other words, if somebody is in the hospital and they have a physical therapist, is that physical therapist blocked because of the limitations on COVID? And we just really didn't get a clear answer. But knowing that there wasn't a clear answer means that we have that place to push from, so that going forward, should the planet catch the cooties again, now we've got a couple pandemics going on, second time, that we can say, hey, I understand you don't want this thing to spread, but also we're the people that have been breathing on your patients the whole time. So we don't generate extra risks, but they shouldn't be prevented from having care services just because I would say the simultaneous or the tandem care services have a preference for us not being there. And so it becomes two things. It's, on the one hand, it's like, again, the devaluing of one type of care versus another. But on the other hand, it's like the patients have a right, the clients have a right to have access to all of their care, regardless of what's going on in the world, in the air, in the world. And so it might just come down to needing to be creative, which we have become experts at, that maybe your support is virtual or some other means, while we are fighting for the absolute right to not even be questioned. If this is my client, I get to be here and support that person. And while we know that from a moral standpoint, it takes a little longer for our systems to embrace that concept.
Thank you for that. I think that's really critical to really, especially as we go into this new Medi-Cal expansion, right? I know I was a part of a team with Diamond Lee, Raina Granberry, and Stella Klingman, who prior to even SB 464 being completed, we were, it was like right in the middle of that, we were a part of the local health justice team for what is now known as the Beatrice Solis Policy Institute, where we put forth the board motion to our LA County supervisors. And we had an advocate in the former supervisor, Mark Ridley Thomas, and advocate in Supervisor Hilda Solis, to be able to get this board motion passed so that they would focus on looking at the opportunity of Medi-Cal coverage for doula services. So super excited to see it have gone forth through SB 65, and now you are doing the work on the expansion and implementation of the bill to ensure coverage. One of the questions that was asked,
may I address
yes,
Ms.
go ahead.
Because I think Noma notes something.
Neoma,
Noma.
go ahead.
That's an Igbo name.
You are very correct with the pronunciation. Thank you, Onyema.
No problem.
Thank you.
I'm excited to just see your name on the call. So yeah, no, I think that there's an interesting part, right? Because legislatively there are constraints, and then there's also the admin policy piece that should be addressed. And I think Neoma raises an interesting avenue that we can address, because I see a conversation happening here between Jan talking about admin policy is different from leg policy. But there's something interesting around, like, how do we influence like the systems? How do we influence beyond the legislative level in our implementation of this work? How do we influence the systems themselves to change their internal policies? And there's something interesting that Noma puts out around, perhaps we can look at reports and reporting, to influence on a grand scale what these systems are doing. And I just wanted to highlight that, because policy happens at different levels, and we can hold certain systems accountable by engaging diverse strategies. So I know, like with the Medi-Cal benefit, there was a conversation as to how, in order to even secure the funding from CMS, how to classify the doulas, right? Whether or not we could classify doulas as providers, and what the implications of classifying them as providers would mean. And so we couldn't classify them as healthcare providers. But if there's a way to, change on a systematic level, like recognizing that we can't classify them as providers for these purposes, yet we recognize their importance and the necessity of having them available and their provision of care, even in the event of the world catching the cooties again, what are alternative ways to impact admin policy of these systems that we can engage in? So I really appreciate that question. And I guess I don't have an answer to it, but I really think it's something important to explore, and you've raised a really good point. So I know I'll be doing some research into impacting admin policy in the way that you've raised, like looking at the impacts of reporting that can shift the culture of these admins. Because as you said, it's not based in science. These things don't, there's no real rhyme or reason. Sometimes it's our biases, right? Or hospital biases or hospital perceptions as to the value of doula care, right? As opposed to, or even just the tensions between, traditional quote unquote acceptable providers versus doula cares that have been proven to not do harm. So those tensions really inform admin policies. So how do we apply pressure in a different way within the system? So sorry. So thank you for raising that. I just wanted to uplift that in the chat. But I see, sorry, Kairos has her hand up too.
Yeah.
In the meantime, your advocates within the system, so those of us who have been a part of pilot programs that are funded by healthcare companies, healthcare providers, they are reticent at times to put their names on this side of the work. Like, they want the work done and they're funding the work, but they are hesitant to put their names on it. And so I know from my end, I said, I need something with your logo and your name that says, it's not just me that's irritated that you won't let me in. Like, there's an entire organization that signs your checks that says, I'm here, they're sending me. And so it took a little bit, but we got that. And so I think just as individual doulas or as doula collectives, that's one of the ways that we can get in, is to really convince our allies on the inside to speak up, to say that, no, this is not just that person that wants to come in, or this is not just that patient that has a doula. This is a whole movement from both ends, from the community side and also from within the system, to try to affect that change. And sometimes it just comes down to relationships. So whatever organization you are a part of, if there is somebody there that can go talk to somebody at whatever local hospital, whatever local birth space there is that they're working in, if you can win that person, you're more likely to be able to get in, because it is subjective, right? It's not just, well, this is the best thing or best practice or the right thing, or, you know, what our clients want, you know. And I understand with the way my control issues are set up, I don't want anybody coming in telling me how to do my job either. So we have to make allowances for the humanness of it all within this thing. But there are small ways to get in, build those relationships, so that when the time comes, you have someone on the inside who can unlock that door.
Thank you for that. I'm going to ask a couple of questions that came up. One was, does private insurance cover doula care? And I don't think that anybody, I know that's coming up, but it has not. But, and Kairos or Elizabeth or Anyima, you could speak to this, but I know one of the things that I encourage folks to do, because we do have some private health insurance providers that are really considering doula care. They're looking at adding that component to their services. Like, for example, Planned Parenthood is working on adding that component. We have some of the local clinics. Kaiser is considering it, Blue Shield. You know, some of them are having the conversations, but I recommend that folks who have private insurance talk to their insurance provider and say, you know, we want doula care as a provision as we work on, folks are working on policy to make that possible. But if any of you want to speak to that.
Sorry.
Go ahead.
Please. I was just going to say, on a whole, we've seen it being added to like employee-owned health plans, which is a slightly different bucket. So that's like where Google and Target and some of those other large organizations, because they actually own their own health insurance within under the confines of like Blue Cross Blue Shield. So, you know, health insurance can be very complicated and multi-layered. So we're seeing those added. There's definitely interest I'm talking to some plans, there's interest. You know, my concern, which is why I mentioned that delay like 12 times when presenting, is that as there's a lot of excitement, that's great, but we don't want to run so fast that we like leave the ball behind. And so there is a significant need for workforce development. There's a significant need for community members to step forward to provide this care for their community, making sure that we have doulas that are representative, not just culturally, but ethnically, racially, and linguistically. And so I'm excited for private health insurance to get in the game, but I don't want them to get in the game in a way that then, you know, I don't know. I have a fear that then like doulas will be like, well, they pay more, so I'll go there. And like, we could lose Medicaid, you know, Medi-Cal. And so, because my heart is always in the Medicaid populations. So just like, it's exciting, but also like, it's not okay to wait because women are dying, but also we don't want to get to a point where there's such a demand and we don't have the ability to fulfill the need. That's almost worse.
My sense is that it's coming. Nobody who's pregnant right now is going to fall under what ultimately ends up happening, but it feels like it's coming. And what I see the insurance companies may be leaning toward is partnering with organizations that are already there, rather than creating this whole new set and system of things to manage. But I feel like it's coming. I know certainly for the organization that partners with Her Health First, that HMO has rolled it out. Every one of their clients has access to doula support as standard of care, as part of care. So it's coming. And as each entity steps into that space, the others will maybe feel more pressure to do so.
Thank you for sharing that. We're about to close out in 1 second, but I did want to see if you can answer one quick question. We'll try to see if we can bring Jan in because she had a question, but one of the questions was somebody asked, how do you navigate your birth work and policy work?
We don't sleep.
Yeah, I think that, that's many of our challenges.
I don't think you can be doing birth work unless you're also doing like this advocacy work. I really think that like all doulas need to know what's happening. They need to be aware because And I'm happy to talk about this offline at another time, but I'm very passionate about looking at what's happened, specifically with midwifery, and making sure that doulas and doula birth workers and community birth keepers do not, let's not let the system create that same harm to us that was created to midwives. So I think you need to be involved. I think you need to be coming. I think you need to be paying attention, because people are going to be making decisions about your scope, about your code of ethics, about how you get paid, why you get paid. And, if it gets too far ahead of us, we can't roll back. So head up, let's go.
That's it. So I want to, Jan, ask your question, then I'm going to let each of these ladies give their 30-second, rollout. I don't know, Morgan, if you had anything specific to, want to let us know upcoming policy on the table. But Jan, ask your question really quickly. And
It's actually not a question, it's a comment,
Okay.
and it's a reminder.
Wait, where's teacher?
And the reminder is that we really want to totally deconstruct the systems, right? Because the systems are not working. If they were working, and then we would have the fixes that we are putting in place would work. But we have systems with that S that are absolutely not working. Inside those systems, there are hierarchies, right? And so what we're doing is we're adding another level to the hierarchy, which really empowers and props up the system a little bit more. And we really need to be dismantling it. Doulas, midwives, nurse practitioners should not have to do policy work. They should be able to focus on their clients. And that is not the system that we have now, none of them. So I'm not looking at how do we, further empower the system. I'm looking at how do we totally dismantle it. But in the meantime, we're trying to, put some Band-Aids in there so folks who are pregnant now will become pregnant in the near future before we are able to take this apart, will have the help, support, assistance, resource that they need to have a healthy birth. But the challenge is—
Thank you, Jan. We gonna bring Jan back, and we're gonna talk about these systems change while we let these beautiful queens that are on this panel close us out. Some people had a question about a doula listserv. I would recommend that you put your contact information. We'll pair you up. We have the frontline doulas as well as the Black Doula Consortium that we are creating there. And I know Shantae Davies-Bauch of the Black Wellness and Prosperity Center, there are a resource guide that's going to list doulas across California. So please drop your information in for the listserv to find out the information, and then we are looking to create a directory. So Morgan, I'll start with you with your closeout. And again, thank you, Queen. You've been doing some powerful work. This medical malpractice is just super exciting. And so I just love for you to just share closeout and tell folks what policy to look for.
Yeah, thank you so much. I know that going forward with policy, thanks to Anima, we're very big supporters of everything she sends down my way. So really, I defer to her when I'm looking for new policy to get behind. I will say the last thing I would say is the power, I think, in advocating for doulas, midwives, and everyone else in between, Black moms and babies, it comes from storytelling. And the more we talk about our experiences and the little ins and outs, the nuances, the red tape, all of that is so pivotal, because as we know, Black women, everyone is different. Everyone's narrative and path and life journey, right, is different. And in order to make policy comprehensive and really representative and really reflective over us and our stories, right, we gotta know what they are. So I say yes to storytelling, and always encourage that amongst each other, because it makes me a better advocate for doulas and midwives and Black moms and babies.
Thank you, Morgan. Thank you so much. Kairos?
So I would say this: birth work is not just about preventing the tragedies, really, and it is about the fact that somebody mentioned joy. It is very rare for Black pregnancies to be met with joy. They are viewed as a mistake, something to be cured, something to be prevented. And so we can lead with that. Like we can celebrate every opportunity there is for another advocate to come into this world. And that we need to remember that birth work is not just about those tragedies. It is really about care that makes sense. And when you have folks, the gatekeepers of autonomy there, when you have folks that can say, you know what, you could induce someone and not necessarily have a negative outcome, but what would happen if, you know, we trusted somebody's body to do what it is doing, that kind of work. So it's the range from the emergencies to the dream experiences, right? And so we just want to get folks to think in terms of the normalcy of it not necessarily having to be emergency measures, but just literally the standard of care. Like that's what we're asking for someone to be loved on through their pregnancy, their labor, and their postpartum by folks who speak their language, who look like them, who've had those same experiences. And that's what it is that we're pushing for. And without that, you do end up with these negative outcomes. In the great state of California, how can anyone be 6 times more likely than anything negative, right? We got clean water, we got clean air, we got, you know, mostly. But I'm saying, like, it comes from the whole thing being embraced and not just putting corks into dams that have cracked, but really the whole scope of wellness by having sisterhood in the art of building families.
Thank you, Kyra, so much. Much obliged. I dropped your story in. We'll try to still show it, if not the end today, throughout the remainder of the week for the conference at some point. Elizabeth, your closeout.
I just want to say thank you. This has been unbelievably inspirational. I'm so honored to like sit up here with these amazing, amazing women and everyone who's here in the participants and listening. This has been, I mean, like we're changing the world right now. And so I just want to say thanks to everybody for showing up and thanks for including me. And my gratitude is huge. And I just lastly want to encourage everyone who's here to stay, because 2 of the most powerful women who've been doing this work in California, Kefri Riley and Dr. Saida Pepper, are about to jump on. So don't go anywhere. If you want to ask some serious questions, they might even have an answer. So thanks.
They are. Thank you. Thank you. Anyema.
Thank you, Ms. Adjoa. Thank you for putting this panel together. Thank you to the phenomenal panelists on this, for sharing your knowledge, wisdom, and experience. Thank you for your work. I'm deeply honored to share space with y'all, and I'm deeply honored for the conversation in the chat, and just even ideas for how to think through, like enhancing and improving sort of the work that we're doing. And this is what's critical about these kind of spaces and these conversations that we're having, just recognizing that, there are ideas floating out there, and there are folks who are experienced and knowledgeable and have great insights around the issues that we may not have even encountered. So spaces like this allow us to do that, and I'm deeply appreciated. So I'm just gonna give a plug, because we need to capture all of these ideas, and we need to, capture folks' engagement. So if you have not become a member of Black Women for Wellness, if you have not plugged in to receive our emails, if you have not plugged in to kind of volunteer, whatever you can do, right? Because life is lifing in this moment and our capacities are stretched. But just putting in a plug to follow us on the socials, sign up for our listservs, feel free to email me or folks on our team with any questions that you may have, with any insights. Yay, I see Monique, I'm a proud member. Just check in, plug in with Black Women for Wellness and Black Women for Wellness Action Project, the C4 side, where all things policy and electoral work occurs. And just thank y'all for this space. Thank you, Ms. Adjoa, for all that you do.
I thank you so much, Anyema, for that. I thank you. I have been volunteering myself for the last 26 years. So I'm super excited to be a volunteer of Black Women for Wellness. I've being voluntold many times by Queen Jan. But I'm so excited for all of you ladies being willing to be a part of this panel, More Than Band-Aid Solutions, for issues around Black infant and maternal health, and really around infant and maternal health for not just our county, but remember, and not just our state, remember other folks are watching us. So what we do here works on a national and even international platform. I'm super excited for how we're going to continue to partner and engage in the work. I thank folks like Nisha, who showed up and said she became a doula. In the chat she shared, she became a doula because she almost died twice. We look forward to talking to you more, talking to Monique Bacon, and answering some of the questions you have. Hopefully some of your questions can be answered in the next panel. But again, thank you, Morgan, Elizabeth, Kairos, and Anyema. You queens have a great day. You all stick around. We have more in store for you. Peace and blessings. All right, we're ready for some Black news. We're ready for some, before the next panelists come
I
up,
was
we have
thinking maybe we should take like a 2-minute break and then
the Black news. Yeah, we might.
You want to go ahead and do the pan
Yeah,
African
we're on a
news?
push.
Okay.
Yeah.
Okay.
It was
So
so much good information.
it was. Lionel, are you here?
Let's remove me. Let's see. How I remove myself.
All right. I'm gonna go ahead and show the reproductive justice talk.
Okay.
And then
and folks,
then I'll
stand up and stretch while you watch the reproductive justice talk. Move around, but do not leave. Please do not leave. Stick around. We have more to come.
Welcome to Black Women and Girls' Reproductive Health Through an Oral Health Lens 5-minute power presentation. My name is Erica Gist, and I'm the Senior Health Educator for the Los Angeles County Department of Public Health Oral Health Program. I'd like to begin this 5-minute power presentation with a quote from what I learned while doing my research on Black women and reproductive oral health disparities and the oral reproductive connection. Quote, "The lack of oral health information and awareness on the importance of oral health in communities of color, coupled with the limited access to dental care before, during, and after pregnancy, is a reproductive justice and birth equity issue." As I go over this slide deck in great detail, I hope that this quote will hit home and that you will have a better understanding of how pre-existing reproductive disparities and the role that poor oral health has on a woman's overall health, including her reproductive health and organs and the health of her unborn child. In Los Angeles County and in the country, Black women experience the highest rates of preterm deliveries, low birth weight babies, and infant and maternal mortality. Also, Black women have the highest age-adjusted prevalence of preeclampsia, which is a blood infection, and are twice as likely to have fertility issues than their white counterparts. Studies have shown that pre-existing tooth and gum problems can be worsened by pregnancy, and the prevalence of periodontal disease is higher in Blacks than whites. Periodontal disease can be a risk factor for adverse pregnancy outcomes like preterm birth, low birth weight, and preeclampsia. So to put all of this in perspective, Black women in general in LA County and the nation have the highest rates of reproductive disparities, preterm birth, low birth weight babies, and preeclampsia, coupled with having higher rates of periodontal disease, may put Black women at an increased rate for even poorer reproductive health outcomes. Let's look at some common infections of the mouth. Mouth infections are not good. They often lead to unbearable toothaches, among other aches in the mouth. Also, mouth infection can spread to other areas of your body if it enters through the bloodstream. It can affect vital organs in the body like the brain and liver and reproductive organs. So let's look at some common infections of the mouth. Tooth decay, also known as caries or cavities, can be caused by a combination of factors, including bacteria in the mouth. Gingivitis are a result of infections and inflammation of the gums and bone that surround and support the teeth. Periodontal disease is a severe gum infection of the tissues that hold the teeth in place. And keep in mind, periodontal disease is very common, or Black women in general are at the highest risk for periodontal disease. Lastly, we have cold sores, also known as fever blisters. These are part of the herpes simplex virus family, also known as herpes simplex virus number 1. And these are fluid-filled blisters that occur around the mouth or possibly inside of the mouth. These types of bacteria of the mouth can lead to inflammation of the mouth and can easily enter into the bloodstream and affect vital organs in the body, including the reproductive organs and an unborn child. The mouth is a part of the body, and there is clearly a connection between oral and reproductive health and overall well-being. The mouth is the primary entryway into the body, and it creates an ideal environment for bacteria to thrive, as it is moist and closed most of the time. Although there are a lot of germs and bacteria in the mouth, most are harmless, provided good oral hygiene is practiced. And if good oral hygiene isn't practiced, bacteria can multiply, enter the bloodstream, and spread to other parts of the body. Studies suggest that germs in the mouth connected to gum disease, which may contribute to conditions including endocarditis, which is inflammation of the heart muscles, cardiovascular disease, diabetes, pregnancy, birth complications, once again to include preterm labor, low birth weight, preeclampsia. Dental care is one of LA County's and the nation's 2 greatest unmet health needs. Specifically, Blacks and other communities of color have the highest rates of tooth decay and gum disease and fewer dental visits than their white counterparts. There are several factors that can contribute to this, like economic hardship and affordability, access, and the social determinants of health, which basically include where you live, can affect your access to dental health care. With the existence of oral health disparities in communities of color, and much work is definitely needed to be done to address the disparities. The good news is that poor oral health is preventable by brushing and flossing. So I encourage you to brush twice a day, every day for 2 minutes, and see a dentist at least twice a year. Here are several resources to help you find a dentist if you do not have a dentist. We have Smile California, which is the Medi-Cal Dental Programs campaign to help members increase utilization of dental benefits. We have 211, which basically connects Angelenos to services like dentists, for example. We have the LA County Department of Public Health, which is a one-stop web page for resources that will we were able to share with you low-cost dental care, as well as oral health incentives and toolkits, as well as reports and much more. And we have a link for how to brush your teeth. So just to recap today's presentation, there is a connection between oral health and reproductive health. Oral health and reproductive health, basically Black women experience the highest rates of oral and reproductive disparities than their white counterparts. There is an equity issue here. The lack of oral health access and resources in Black communities is a reproductive and equity issue. Preventative, most oral health diseases are preventable, that is, and resources. There are free and low-cost dental health services available to you. If you would like to gather more information about myself or more information about this particular presentation, I do have listed here my biography that could also be found on the Whova platform under this conference. And I would like to say thank you all for your time, and have a great day. Thank you.
Thank you so much, Miss Erica. That was a great presentation, reminding me after I have this lovely apple to go in there and brush my choppers, you know, rinse my mouth. This is very critical. Oral health is definitely, can be a definite gateway to other illness and disease, and it's very imperative that we take better care of our oral health and are acknowledgeable as such for even our infants as well as ourselves as adults. So excited and thankful for that presentation. All right, it looks like we are going to move on. We have so much on the agenda. If we don't, can we quickly get our Black news up? If not, I'm going to let us go ahead and start our second panel.
Lionel, you ready?
Yes, I'm ready.
Okay.
Can we What's our time frame?
About 3 minutes.
Okay, perfect. Thank you.
Good morning and welcome to Pan-African World News with Black African Wellness on August 15, 2022. It is a known fact that the climate crisis is having and will have a disproportionate impact on people of color around the world, especially those occupying impoverished countries or areas. Among the many negative consequences of the climate crisis, with new research, the public health field is having a better understanding on how climate change negatively impacts maternal health outcomes. This means that in places like the US, where maternal health outcomes for Black women are already poor, we may see negative impacts on maternal health increasing multiple folds without proper policy and infrastructure change. When discussing climate change's impact on the health of women, there is a wide range of climate risk factors that have a direct impact on maternal health, like extreme heat, worsening floods, severe hurricanes, thickening air pollution. All of these environmental stressors can cause increased risk of preterm birth, long-term infant morbidity and mortality, pregnancy-related complications, and poor maternal mental health. Specifically, when speaking to extreme heat, long-term exposure to extreme heat on pregnant women can cause preterm births and long-term infant morbidity and mortality due to maternal dehydration, as well as the inability to thermoregulate during pregnancy. Congenital heart attacks and poor exchange of nutrients and gas across the placenta. With the recent study citing 10-degree Fahrenheit increase, and temperatures were associated with 8.6% increases in the rates of preterm deliveries. Such regions that Black and Hispanic people occupy, like the South, Southwest, and the West of the United States, are regions that are projected to experience such increases in heat. This story, although scary, does not conclude without any hope for the future. With proper work from the people, as well as federal and state policymakers that are now more than ever needing to take urgent action in strengthening infrastructure to target those living in climate change risk zones, by increasing resource allocation, developing better policy for anti-discriminatory practices in medicine, improving housing and local resilience, expanding across access to maternal infant health services, expanding health insurance coverage, and increasing access to reproductive health care services, to include contraceptives. Colombia is a multicolored country with a varied customs, practices, and celebrations. Within that level of inclusion, we need to add traditional midwifery, said Lady Manuela Mosqueda Moreno, an Afro-Colombian nurse and the executive director of the Association of the Interethnic Network of Midwifery Practitioners of the Department of Chocó. Despite great strides made in improving the maternal death rate in Colombia, such improvements have not reached Afro-Indigenous Colombian communities, where maternal death rates are 2 to 4 times higher, and this disparity has only worsened during the COVID-19 pandemic. Some reasons behind these disparities being seen in Colombia are challenging geographical obstacles, economic marginalization and isolation, lack of proper health clinics, institutions and services, cultural obstacles, language barriers, or religious obstacles. Within this, such nurses as Ms. Mosqueda see a solution: traditional birth attendants and midwives. With her organization alongside the UN and the Partera Vital project, they believe that providing Afro and Indigenous Colombian communities with health workers with modern skills and tools allows for outsiders of these communities to guide women and communities safely and to improve maternal outcomes, as well as sexual and reproductive health. Through intensive and expansive training and strengthening of food and nutritional access to more remote communities, members of the Partera Vital project are empowering such communities like the Arhuaca and Waiyu communities to embrace a more modern yet intercultural approach to healthcare. This mutual respect of indigenous traditions and perspectives can be seen through the employment of community health workers that are members of the community, honored by the elders of the Waiyu Matriarchal Society. Traditional practitioners are bringing modern medicine access to otherwise remote and culturally preservant communities. In a beautiful success story, Maria Kimbar was hesitant to go to her nearby maternal clinic in Northern Colombia, even while in active labor. but a community health worker, Leila Yudeta Gonzalez, made sure to ensure Ms. Kampar of her intention to respect her indigenous traditions and perspectives if she would accept the medical assistance. Once in the clinic, Kampar had access to an interpreter and was even able to sleep in a bed similar to the hand-woven hammock she used in her own home. Then, giving birth to a healthy baby boy, Ms. Mosqueda reflects on the importance of such culturally competent practices. Why is it important? Because this allowed and still allows a link between ancestral knowledge and all actions that in one way or another are articulated within the health services. Ms. Mosqueda, as well as rightfully very proud of her work she has brought to her communities, closing the health disparities in Colombia seen in Afro and Indigenous communities, crediting the midwife who considers herself trained from the ancestral perspective, yet with the necessary skills and techniques to adequately assist a delivery. And this concludes our Pan-African World News for today. Thank you.
Thank you very much, Lonell. We appreciate the offering and the share, and really learning more about those are our brothers and sisters across the diaspora and the work that they're doing. At this time, you all get ready for a lovely, great share and dialogue and engagement with several of our colleagues that have founded and are doing great work as doulas and have created collectives for other doulas and are constantly working behind the scenes and on the front line to ensure that Black women, birthing people, people of color, and all women have great services and enjoy our lead service to be supported in their pregnancy and birthing journey. So without further ado, I'm going to introduce them one by one, and I will call them up to the stage, and you all just celebrate and support them as they join me. And so first, I would like to introduce you all to Dr. Saida Pepper Wilson. She is a licensed clinical psychologist and doula. She specializes in multicultural psychology, trauma, suicide prevention, and maternal mental health. She's an advocate for human rights in childbirth. Dr. Saida is a member of the Black Women Birthing Justice Collective and a collaborator with the Black Mamas Matter Alliance, promoting research, education, and community-based services to positively transform the birthing experiences of Black families. She is also the co-founder and director of the Frontline Doulas Centering the Community Programs and co-founder and co-coordinator of the Sankofa Birth Workers Collective of the Inland Empire in Southern California. Dr. Saida is the founder and executive director of the nonprofit organization Diversity of Bliss, Inc., and she's focused on supporting communities and increasing cultural conscientiousness and humility among providers who serve them. Listen, the queen is doing it all. At one point, I'm like, you know what? Does she have anything else she wants to find, develop, coordinate? I'm so proud to be sharing this space with her. Please, someone bring her. Yep, here she is. My sister queen, Dr. Saida Pepper Wilson. I said, if she co-founds, you're going to have to answer that question, because somebody asked the question of how do you do the birth work and policy and all this work and parenting that she does, and so much more. I won't share all of her personal work, but it didn't even put on there that you're a part of the Black Doula Consortium and so much more. So thank you so much for being here. I'm going to bring up next Queen Goddess, Urban Goddess Lifestyle Los Angeles birth partner, Kefri Riley. Kefri is a woman's mysteries mentor who comes from a lineage of birth keepers, preserving the art of the intuitive wise woman through everyday divine experiences. She is the CEO of Kefri.com, Urban Goddess Lifestyle, and Los Angeles Birth Partners. She also serves as co-founder and co-director of the Frontline Doula, Centering the Program. Her foray in the world of babies has its inspiration from 3 generations of Black birth workers, in particular, her paternal great-grandmother, an African indigenous grandmother midwife from the Deep South. Kefri is a childbirth educator and prenatal yoga specialist. and has taught thousands of people to mindfully embody the multifaceted experience of new parenthood. She brings over 20 years of experience as a certified lactation educator, counselor, and birth and postpartum doula. She is also a doula trainer, a newborn care and childbirth educator, and hypno doula. Kefri has attended over 300 births. And, I got to take my hat off to her. She has also been at, 300 births at hospitals in LA County. Her infant classes have been featured in People Magazine, NBC, CNN, and Fox Channel 11 News. Without further ado, welcome the goddess, Kefri Riley. I love these sisters. She's also a part of the Black Doula Consortium. She's also, both of them were my trainers, my doula trainers and educators, brought into the training piece for AIM with Kimberly Durton. And so last but not least, you know what? I always, Deidre's last name, somebody pronounce it for me because I say it and then I get tongue-tied and twisted. Deidre.
It's Kutsumpos.
Kutsumpos, yes,
thank you. Absolutely.
Thank you. Okay, yes. I was like, I want to say it right. That's how I was with Sister Kyra's earlier. I was like, it's Chianji? But she had it, so Kutsumpos. Deidre has been walking with birthing and breastfeeding families for 17 years. Her career has expanded to coordinating the Doula Access Program. DAP provides public health insurance members with doulas throughout the Inland Empire. Deidre is a proud member and co-founder of the Sankofa Birth Workers Collective of the Inland Empire, a collective of Black birth workers that serve Riverside and San Bernardino counties. Her passion to create safe space for Black birthing women and families now includes coordinating the Sankofa Doula Community Program, the Community Doula Program, and training new doulas in the SBCIE Black Community Doula Training. Super excited. In partnership with the Riverside Community Health Foundation. I'm really, really excited about that one. Deidre also coordinates community-based doula trainings for BIPOC folks. She is a quiet but powerful force, y'all, and making me want to pull out my hats from back here because I'm seeing all those crowns, additional crowns behind you. So welcome, Deidre, Kefri, and Saida. I'm gonna step back and allow you all, you queens, to take it away and have your fireside chat. Thank you again.
Oh, we love you, Adjoa. And I think if you don't feel it, there's so much love in this space for each other. And that's a lot of how we do what we do, is we start with the love. So, well, I think one of the things that we wanted to start with is just, as we're community doula directors, each of us, we work in multiple programs. We wanted to just start off with, for anybody who's listening that doesn't know the difference between a community doula and traditional doulas, or, I often say a business direct doula, is so that we can have a context for why it's, innovative and creative and unique what we do as community doula coordinators and leaders and trainers. And so, a traditional doula, their first and primary relationship is with the individual and or family that hire them, right? And so they are solicited typically directly by the family. They negotiate or communicate what the pay is going to be. They're often paid directly by that family, which means that the family has the wherewithal, the information, they know what a doula is, they solicited it, they're activated, they're interested, and they have decided to invest their own finances in having a doula. And so that automatically brings to the table some, as we think about social determinants of health, we think about community, who are people who hire people to help them support their lives, right? And what faculties, resources, information, access do you have to even be in a place where you're hiring someone to support you in childbirth and in the postpartum period? Then you have, the aspect that you have an individual who's paying you. There's no organization. There may not even be a robust invoicing process. It could be they PayPal you, Zelle you, they hand you cash.
whatever it is that you decided, it's on your terms and you've created that. And you work within your own personal, autonomous, independent system. The way you doula is the way you doula. And if you talk to doulas who have practiced doulaing through years, they may have very distinct things that they do. There are things that we typically uniformly do, but people have their own style, their own expertise. One doula may do placenta encapsulation. Another doula, also does massage. Another doula is really more of a spiritual doula and they're connected with you. And another doula is more of a practical, life coach doula. Another one is a hands-on, they're always hands-on with your body doula, right? And so doulaing in the traditional, as in the sense that it's happened before we've created community programs, has been independent and sovereign and unique and business modeled and direct pay. So then you have the community doula, programs and systems that really are addressing predominantly the people who could never access those doulas. They didn't have the money. They don't know what a doula is. Doulas aren't accessible in their area. Culturally, they haven't been accessible. Language-wise, they haven't been accessible. And they haven't necessarily reflected, depending on where people are living. Even in California, we have such a diverse scenario, people from their community. And so community doulas are people who reflect the community of the people that they're serving most often. They are often providing services for free or low cost or, scaled, but really focused on feeling the need for disparities like we have just heard about today. And not just to be there because a person just has asked them to be there. This is often the response to a crisis, to a situation, to a need in a community. There's a sense of urgency also because social determinants wrapped around a lot of times, a lot of the community clients are more than you have and you experience with clients that have the money and the resources to direct pay. And there are a lot of things that are connected with that, which will sort of unfold. And anything else that the two of you thought that I didn't touch that you feel like we want to put on the stage?
I think another one of the aspects that I didn't hear you mention was also how the doulas collect data. That's part of what we do is data collection. And it's not just for their own personal records. Some private or direct doulas would do that just for their own statistics. But one of the things we're finding in our program, specifically when they're attached to county grants and things of that nature, the doulas are now going to have to report data in a way that is a lot more specific. It is dictated to them the manner in which that data needs to be collected, and then as program directors, we have to make sure that data is tabulated in a way that's in accordance with the entire state to make sure that we are actually doing what the research says that doulas do, which is improving outcomes for families, even though that's not necessarily a doula in general, that's not their main focus to improve outcomes. It's really to stay present with the families. So that's another aspect that really sets apart or sets aside community doulas versus private doulas.
Yes, and also I find that community doulas are more robustly trained. They're more robustly trained. They're held to excellence in a way that, and when you're operating in private practice, depending on your mentorship opportunities there, we are held accountable to the community, to the program, and to the goals of the organization that they're working with or collaborating with. Also, there's more workforce development that they're asked to engage in and take part in. And so I believe that the load is much heavier and more demanding on a community doula than a traditional doula who's in private practice. So there's a lot more going on with them, and there's a lot more that they're offering to the clients, and I think that sometimes when we look at the word community, it may have its own discrimination that's put on it, when we're walking into hospitals and having to explain what doulas do in general, let alone what a community doula does. But actually, I think they're the gold standard.
I love that. All right, so now we're going to give you a sense of we, run and coordinate and support community doula programs. So we're going to talk about our programs a little bit to give a sense of the uniqueness and what we're doing. So starting with Deidre with Sankofa.
Absolutely. Community doula isn't just about serving the community, but it's actually creating a community for doulas and birth workers. And that was the goal when we started Sankofa. I relocated to California nearly 12 years ago. And when I came, I'm like, are there any Black doulas out there? And so over time, we did get connected, and about this is almost 4 years ago. We're getting ready to celebrate our 4th anniversary. It's about 6 or 7 of us together. We founded the Sankofa Birth Workers Collective of the Inland Empire. The idea behind it is to first create a space of nurturing, community building, skills sharing, mentoring for the Black birthing community. When a doula is practicing privately, it can be very solitary work. You may have 1 or 2 doulas that you either debrief with or utilize for backups, but you're disconnected from a larger community. So we wanted to make sure that we could create a community specifically for individuals, for them to feel seen, heard, celebrated, and then also empower them to go out into the community and do the work. And this is the impetus behind the Sankofa Birth Workers Collective. Currently, in addition to just a space where people can come and ask questions, get resources, share information about trainings and other ways to build their own capacity. We, as was mentioned in the bios, we have a county grant with Riverside and San Bernardino County, where we've got this outcropping called the Sankofa Community Doula Program, where we have contracted doulas who are providing Black doula services for Black families across Riverside and San Bernardino County. It's really exciting. In addition to that, we are in partnership with other organizations in our community, namely the Riverside Community Health Foundation, where we are providing Black community doula trainings specifically that not only focus on the Inland Empire, where professionals come and talk about different aspects of what they do and how they serve this specific community, but also potentially prepare them to serve the community as well, in addition to, if they choose, to being a direct business doula. And we are hoping that will grow as our collective grows. We currently have about 100 members who are not only doulas, but midwives, lactation professionals, perinatal physical health educators, mental health professionals, anybody who really touches the body within the childbearing year or provides support during the childbearing year. They are welcome to join our Sankofa Birth Workers Collective.
Awesome. All right, and then Kefri on Frontline.
Okay, thank you. So the Frontline Doulas are an uplifting generation of community doulas on the front line of birth in the Black community, co-creating and reclaiming family-centered narratives for generations to come. We always think about the future, constantly innovating and creating ways to touch not just now, but what we see is needed for these babies that are being born right now. And actually, there are teachers. So basically, we are really listening. The Frontline Doulas is a community-based program that provides non-medical professional perinatal support. Our community doula programs, which include the Frontline Doula Centering the Community program, the Frontline Doulas Black Doula Match program, that's our current one that you can engage in right now and send people to. The Frontline Doula Hotline, which is Black telehealth services for Black families, and the Black Doula Awards. Within those programs, we provide physical, emotional, informational, psychosocial, and advocacy support to Black or African-American families during the pregnancy, childbirth, and postpartum period. And while we mainly serve LA County, our Frontline Doula Hotline serves California and all of the United States, and the Black Doula Awards has served many other counties in California. And basically, we've served over 350 families, I believe, through our various programs just since the summer of 2020. And we've had 0 preterm births in those programs. And we've basically, I believe in our last program, we've got an 18% cesarean, which from the national average of 36% is about a 50% decrease. So we're really proud of the work that we're doing and the hard work that our doulas are putting in to make that, and also the hard work the moms and the birthing families are doing to push those babies out and to stay focused on the goal. Right. And I like to remind us that although current narrative says, oh, we want a healthy baby, right? We want a healthy baby. Well, we actually want a healthy family. We want the entire family unit and structure, including the partner, the grandmother, the cousins, the sisters, when they go back home into the community to be whole and healed and feel loved. And so that's what Frontline does. We create this container of love and support for our families.
And I just want to, give context. So I live between Los Angeles and the Inland Empire. I live in the Inland Empire, but I have my children in Los Angeles County on Medi-Cal. As Kefri and I, we often, just reminisce about like all of the experiences as we work so much with populations that also are on Medi-Cal now. And so positioned where I live in San Bernardino, Inland Empire, but have roots and connections in Los Angeles. And also what we've seen in birth work, which I think many of us see in sisterhood and in leadership and in family, is that when we do it together as a collective, when we support each other, when we leverage what we already have, it's better, it's easier, it feels more connected. And so even though we have separate programs, Sankofa Birth Workers Collective and the Frontline Doulas, there are elements where some of our doulas in Sankofa are a part of the Frontline Doula Hotline. We have, you know, doulas that are in the Inland Empire who have been serving Los Angeles families for forever because, you know, these artificial boundaries don't stop people from living places, people's mamas from living on one side of the track to the other side of the track. We say that in the East Coast, we have all these like railroad tracks, and it often was that there was like a black side and a white side of the track. And so, you know, just in thought of like what community looks like, it also looks like at leadership levels, we collaborate. When we do trainings for one of our doula sets, we're like, hey, this would benefit the other community doula, you know, group that's right here. It's just really powerful to work in collaboration. We have other community doula programs around California. We didn't want to take the space and not really mention that, even though we're going to center our own experiences, but we know we've had shared experiences, and some of the things that we share, many community doula leaders and coordinators and developers and directors will be like, yes, amen, experience that, right? And so some of the shout out for those programs, obviously in Los Angeles, we have the AIM Community Doulas, in Frontline, in the Inland Empire, we have Sankofa. In Long Beach, we have the Long Beach Birth Workers of Color Collective, South Bay SBCC, the Strengths-Based Community Change, Thrive LA. In Northern California, we have our sisters at Her Health First in Sacramento, Roots of Labor Birth Collective in the Bay Area, Sister Web in San Francisco, Samsara and the Community Doulas with the Better Birth Foundation also serving the Bay Area, and so many others, and those that are not connected to organizations or community doula programs, but we know y'all are out in these streets handling families in our communities, and we, all of us, the three of us here, want to create space so that everybody has a home. So there's people who rock with us and are connected with us that are not in our programs, but we feel that we are a home and a support as well. And just a bit of a shout out to Black Women Birth and Justice, who has a Black Birth Worker Forum for all of those of us that are out here doing this birth work that don't have a home to do mentorship and case conceptualization and support each other. There's a home for you. It's, you know, almost free, and filled with people who really want to be there to support each other in this work, while we create all these systems to support ourselves directly. So just a shout out for all of that. All right, so we are going to talk a little bit about our leadership approach and some of our experience as leaders. I'm going to start with Deidre, you know, just really centering how do you identify your unique and innovative leadership approaches and experiences?
Yeah, so as I mentioned earlier, part of what we really do is truly creating community. And in that, when you're creating community, we're doing our best to show up for one another, to first show up for ourselves. And I was reminded of the quote from Audre Lorde: caring for myself is not self-indulgence, it is self-preservation, and that is an act of political warfare. This work we're doing, we are literally, just as Kefri and Saïd's program's called, we're putting doulas on the front lines. They are going out, they are waging a war, but not necessarily like this physical battle. They are there to like clear the path to create something new, not just physically in our communities, but like Kefri said, for future generations. We are modeling for families how life can actually be just by sitting with them, being present, being quiet, showing them what care and compassion looks like, showing up for them, answering their calls, being with them in a time of need, in a time where they're the most vulnerable. And so as part of my job, actually the majority, let me try this again. The lens which I like to lead through is, what does it look like to create space for my doulas, or for the doulas that are in my program, to make sure that they're taking care of myself? What does that look like for me to create accountability, to help support whatever that needs, whether it's creating boundaries with clients, or creating a self-care plan as they not just navigate this work, but perhaps other jobs, their families, their partnerships. And so that is the foundation, is when we are creating space for people to fill their own cups, then we can do this work to the best of our ability. This work is not for the faint of heart. And we all recognize that. And we really want to make sure our doulas have what they need in order to be able to give their families what they need. And so when I think of like my leadership style, it's how do we first care for our community so that we can really care for the greater community.
I would add to that, that one of the unique situations for us as leaders, the three of us in particular, and many others who have been in these roles over the past 2 years, is that we've done it under a duressful situation. We have created and developed and supported and strategized under a global pandemic. And what that has done in the birth work world has been really intense, because all the other things that shut down and pause, babies don't shut down and pause, breastfeeding doesn't shut down and pause, you know, that your water's going to break on its own time, not necessarily conveniently when the hospital has room for you. And so you might be, as we've experienced, in your car in the parking lot of the hospital being told, nope, you can't come in right now because we don't have room for you. So work it out. And I'm always in those moments as a leader where the doula's calling on the phone, like, I'm in the parking lot. They said they're not gonna let her in. What do I do? You know, and it's like, well, if we ever were on the front lines, here we are today, and we're just gonna doula right there in the parking lot and be there with our sister. And, you know, where people couldn't get rides because there was no transportation, and just like what it looks like to be community doulas and to support community doulas is like nothing anybody has experienced unless they work with people who are in, I would say, really extreme critical scenarios. Like,
really quick, I just wanted to blaze
through
this.
Don't worry about it. I'll handle it. Everybody mute their stuff. Okay, thanks.
No worries. You know, and so just, you know, that's one thing I would say that's been unique, is that we have, for our own lives, for our own families, all of us who have children who are home or had children who weren't able to go to college now and they have to be home, or whatever the situation is, we've had to manage our own households, support and be an anchor and a grounding for teams of doulas who are then going into homes of people who are also feeling ungrounded. And that's just layer on top of layer of pressure. And so we've needed to support each other. And I think what's unique is that we have found ways to take deep breaths together and play a song together, you know, and, you know, be with each other through losses that our other leaders have experienced, and make this work that we do as doulas for ourselves, you know. And so we're always doulaing each other and doulaing our doulas, and the doulas are doulaing the clients, and the cycle continues. So, yeah.
At the same time, we're building the mothership as we're learning how to fly it. Like, we literally are using our intuition, our instinct, our creativity, and creating and manifesting things out of thin air. You know, this did not exist before we started doing this, in the sense of these large scale community programs acting within a pandemic, right? So all of a sudden now we've got to solve the problems in the hospitals, right? And this burden being put back on the doulas, which is absolutely inappropriate. We may help mitigate some of these things, but, you know, we are all supposed to collectively solve these problems, not just be putting it on one person in the care team. So we're building this mothership as we're learning how to fly it. At the same time, by activating our own intuition and creativity, we have to be mindfully mirror and engage and reflect that back to the doulas and all those in our program, so that the doulas can actually lead with their intuition and their instinct as well. This is a heart-centered leadership, very mindful. So we meditate, we pray, we sing, we dance, we smile, we cry, we allow the real feelings to root ourselves and feel very, very grounded while we're doing so. So we have to embody the courage and embody the joy, embody the grace, you know, in this mutual well-being. Because if we're not good in leadership, then our doulas aren't good. If our doulas ain't good, then we're not good. This is a very interconnected, I would say almost like on a quantum leadership, if you will. How we are, they are. How they are, we are, and so forth for our clients. And when we think about how do we get these results, oftentimes we go, well, it must be spirit, but definitely our intentionality. So we are highly intentional in how we create. And for me, the legacy is excellence. And personally, excellence is all that we're going to accept. Very high level standards. I'm sorry, I'm going to keep it very real. That's how we get to where we're going, is really maintaining that vision, knowing that we're standing on the shoulders of the great ones.
Absolutely. All right, staying with you, Kefri, can you tell us what advocacy looks like in Black community birth work?
It means burn the whole shit down. No, I'm kidding, I'm kidding. No, that's not what it means. However, we do utilize that fire. You know, I love to talk it through the elements when we're working in these type of presentations, and fire is one of the powerful elements that we kind of contemplate and embody in a lot of the advocacy work. But advocacy really is activating and holding presence to and uplifting the autonomy and the sovereignty of the birthing person and the birthing family. So especially for community doula work, advocacy is not just for the birthing family, but you often may have to also advocate for yourself and for the program at large. Advocacy sometimes can look like activism, but it is very different. And so when we understand that advocacy is centering human rights and informed decision-making, shared decision-making, it's one thing for us to know that, but how can we activate this and kind of tend the fire in our clients? Because if we do this before the birth and are this kind of agent for advocacy and change as we're working with our clients leading up to the birth, they will center their voice. Their voice will be activated. Their mouths will feel free. Their throats, their whole body will be connected into their birthing experience. And so for me, when you think about autonomy and sovereignty, they're not just abstract concepts. We really need that to be taking place in the birthing room. And so the doula is there as a protector and a guide, but actually helps to uplift the voice, because really, it's the birthing person. The mother has to say what she wants or they want. They have to speak up. They have to say it because it's their body. And while we are interconnected, we have to unpack our own biases as well. Like I know my bias. I know how strongly I feel about advocacy and birth work when I'm at a birth. How does my client really feel though? Have I really gotten to know them and learned about what their wants are and their needs are? Am I projecting my wants and needs onto them? Might be. Right? I have my own biases. And I think as advocates, we have to unpack that. And we have to accept the reality of this, you know, this hierarchical violence that happens. And as the violence is happening to the birthing person and the families, it doesn't just stop in the hospital room, it goes home. Right? And so that's why I believe it starts way before the birth, our advocacy. And if we can engage our clients in engaging their caregivers and the systems before we get to the birthing time where they're pushing out their baby and they say, no, I don't want that episiotomy, probably is too late. Right. So for me, advocacy is about uplifting sovereignty and maintaining the cultural fire for the birthing family.
And I just want to say on that, you know, when we're thinking about the uniqueness of community clients, and that's a broad term that means so many things. But one of the things that we see in practice is that a lot of us, and this is across the board in Black community, I would say, and maybe, you know, other people of color probably experience this, of a learned helplessness and a sense of a lack of sovereignty around your choices and a fear that people will say that you're too aggressive or too angry or you'll get in trouble. And so there's a playing nice that happens when you get into fight or flight with your attacker, right? It's a normal, natural response to feel like if you have power, which you do as a doctor in a hospital or a nurse or somebody who is making decisions that can alter your experience, and is coming with that vibe, right? You could be in that position and not enforce that power, but you do indeed have it. You have more information. You have, you know, more access to what's going on in the space. When a person feels like that person could do harm to them or to their baby, and they're in a vulnerable state, it's more likely that they're gonna play nice so that you stop trying to hurt them, or so they stop feeling like you don't activate more aggression in them. And what's unfortunate about that learned experience that we have as people who've experienced historical racism and various types of trauma in our communities is that it gets perpetuated in moments where this is the time, even though it's hard and it's uncomfortable and we're not sure if we're safe in saying something. But if we don't say something and we don't have the tools to say something, there could be a catastrophic impact for us, and they just go home and send you off and you're just another number on the thing, right? And so the doula really also fits in the space, particularly in community work, of helping to develop and cultivate that confidence in the birthing person around their right to say that they're feeling uncomfortable, their right to ask someone. So live example, you know, somebody comes in and they've asked because they've had, you know, sexual trauma history that they don't want men in the room, and the male residents keep coming in And it's like, oh, well, is this okay? Well, okay, it's okay, right? Because that's a typical trauma response to like not say, no, I'm uncomfortable. And I already said I didn't want this and it's on the wall, it's in my birth plan. And you're in labor, having contractions every 2, 3, 4 minutes, and that's intense. And you're trying to focus on your own experience. Advocating in that moment, in that way directly is hard, right? And so the doula then, if you have worked with them early and we've talked about when something happens that you don't like, how do you want to communicate this? Okay, well, your partner's here. So that might be a tap on their shoulder, say something to them. I don't want to be in a position where I have to say something in the middle of my contraction, but I want to make sure there are no men in this space, right? And so it's so much more than labor support. I mean, when we use the term labor support, that's what we're thinking of. All of these dynamic situations to help contain this beautiful moment that they get to birth in. And that's the battle, you know, the battling over birth that BWBJ talks about, and the frontline term that makes that, you know, references like being on a battlefield to maintain that sovereignty and that space for the sacredness that's happening. You know, and it's a work depending on who's in front of you and how much consciousness that they have. So just lifting that up and giving practicality to what we're talking about.
You know, in the Black doula programs and Black doulas in general, you know, we are not representing the dominant doula paradigm. We are not out here representing the traditional dominant doula training organizations anymore. They actually don't center advocacy. And in many ways, when certain policies were being made to include doulas, it's very clear that advocacy is not centered specifically from those dominant doula training organizations, right? But we're saying that's not true. Advocacy actually comes to the top of the list, and understanding how we can better our advocacy, understanding tools of nonviolent communication, understanding how these traumas also affect us as birth workers so that we take care of ourselves, so we're ready to be the advocates that our clients need. And I think that, you know, we're really shifting the culture here to have these conversations directly with hospitals and systems that create harm, so that way you're going to know that when our doulas are there, they're going to be respectful, they're going to be loving, but they actually 100% know the rights that an advocate has, a patient advocate and or an ombudsman and or a chaplain, et cetera. We're part of the care team. We're collaborating. We're not here to tell you what to do or to speak on behalf of our clients, but we do know that it is okay to drink and eat during labor. We aren't a fool. We actually know the evidence, right? We are highly trained and we're here to stand in that cultural competency and be that agent of change. And I think that was not expected, honey. 20 years ago when I became a doula, believe me, they didn't expect this moment. Okay, so right now we are in a very powerful Black doula zeitgeist moment, and centering this advocacy or uplifting it is what's going to create change for, you know, can you imagine the babies that are going to be birthing their babies or our granddaughters or our grandsons? It's quite phenomenal. Deidre, I see you. I wonder if you had anything to share.
I was just going to piggyback on that. Yes, advocacy does. Our doulas do that for help the clients to elevate their voices. And I think Kefri touched on this a little bit, but advocacy also includes on the part of those who can, educating the hospital staff, letting them know what opportunities they have and how we can work more in collaboration, not just saying, okay, well, these are the rates and what can you do about it? But no, these are just some actionable steps that you can actually take right now. We're not just talking about this as a concept or just some nebulous idea or numbers on paper. We are giving you tools. We're actually being your doula so that you can accept and receive our doulas and actually care for our patients in a way that's going to be helpful to, again, improve the outcomes. I feel like so education on the part of the hospital staff, and it's not just in hospital, but also in the office with the office managers, with anybody again who comes in contact with that person has a bearing on how that person's experience will be, because bias lives everywhere. And one thing that we do know is that our birthing families are going to remember how they were treated like 80 years from now, way after their babies aren't babies anymore. And it's not just about attaining the outcomes, but also about helping our patients and our clients feel empowered, feel like they are completely seen and heard and celebrated as an entire and whole human. And this is what we're really trying to uplift, is this idea of whole person care. How do we care for not just the baby or not just the medical side, but how do we really shift our focus, and how do we advocate for this cultural focus on whole person care for the birthing people? And so these are multiple ways where we can do that. I did see I feel like there's also a little bit of bridge to the question that Ajwa dropped in the chat about how do we include partners? This is not just on the birthing person. It's absolutely unfair to put all of this onus on the pregnant person. This is, again, when we talk about community, it's not just the individual and how individual people work with individual people, but our job is to, and our doula's job is to incorporate a community around the birthing person. If we think of the birthing person as the affected individual, who are the people who are closest to her, who can create what I like to, in my classes, we talk about creating this force field of support, regardless of what's coming to them, how can they help protect this birthing person? So this would first start with the partner. Doulas, again, are not there to replace anybody, but to be an integral part of the team to help families feel safe, regardless of what comes their way, regardless of how things might shift and change. But really, how do we keep that birthing person present? How do we keep the support persons around her aware, and also help them to understand what their rights are, and how can we still hold on to some of the integrity of what a plan might be, even while things are changing and negotiating. And so this is one of the things that doulas do, is they're not just supporting the birthing person, but they're whispering in the partner's ear, taking care of the grandma in the corner, keeping everybody kind of up to date and giving these little news updates. This is what's happening. This is why this is happening. They're to decode what might be happening. I like to say decode doctor speak, so to speak, so that everybody can not just support the birthing person, but understand what's happening as things are unfolding or as things are changing during the process, during labor and birth. And so this is one of the tools, this is one of the roles that a doula plays, in addition to supporting the birthing person, to help really involve not just the partner, but anybody else, because they're going to be there when the doula cannot. We were talking about doulas creating healthy boundaries in order to care for themselves. Sometimes a doula will meet a family and be like, oh, I feel so bad. Here's all this slack, and I just want to help her all the way. We are not here to be burnt out Black people. We can't do that. There's no way that we can continue making these changes if we are putting ourselves at detriment. Absolutely not. So again, as the doulas are learning how to care for themselves and create boundaries and creating care plans, this is what we do for them. We're encouraging them to do that with their families. Who can you call into this? Yes, this is happening, and everybody's so excited that this baby coming, but how can we activate that birthing person's community to come around them so that they can support, so that they know some of the warning signs and things like that they might need to call for extra help, so that, because the doula will not always be there outside of the labor and birth. So these are some ways that we can really ignite and help to create some more support with the birthing person's community.
Deidre, I just want to say the grandmother is coming through you right now with that. I feel her so much. How do we take care of the community? How do we activate in the community? How do we activate that innate intelligence that has been that is suffering and suffocated through white supremacy, colonialism, industrialization? I mean, it's like we're suffered, and you can just doulas kind of help just lift that veil away, and it's just this beautiful taking an inhale of your liberation, and you exhale and push out your baby. It's not really that serious, right? It's just birth. It's primal. That baby is coming out of you. Okay, it's not staying inside. But what we have to deconstruct are these systems that create the harm. And so as soon as that doctor or nurse walks in and they got the tag and they got the pens in the, right here, and they come in with the clipboard, all of a sudden we just go right back into our trauma bond, right back into what we're supposed to act like. And we immediately give our power away. And so I find the magic that doulas do and these programs that we're activating within is that we basically are just saying, we stand with you in your power. We witness you, we see it, that veil is lifted, go forth, and I've got your back, and remember, I think about Biddy Mason, great mother Biddy. I have her picture right here. She's one of the most famous Angelinos, founding mothers of Los Angeles, and a grand midwife, an herbalist. She had to free herself twice from slavery. I'm pretty sure she wasn't afraid of advocating for herself when she had to appear in court to free herself from her slave master. I don't think she was like, well, no, she stood very firm in what she knew was her right to be free. And I think that we just have to remember, we don't have to play small here. And so we don't encourage our clients to play small. We don't encourage them, at all, nor our doulas. And I think that we can only do that by mirroring and having these conversations. And we'd love to hear in the chat from you, your experiences of that. And because this is not just about birth, it might be for our child, it might be for our elders. There's so many ways that advocacy is needed in our community, and for us to get even stronger and understand the nuances of it.
So many powerful things. So a couple of things I want to highlight, since we are going to be closing in 10 minutes, is that we're going to have more conversations about the role and the benefit of partners, and also in particular male doulas and the Black Doula Consortium. So I know at some point you'll see stuff. Stay tuned to Black Doula Consortium and ADWA and all of our social medias, because we will be engaging some male doulas to talk about fatherhood and male doulaing in the birth space, which is so powerful. We just wanted to say a little bit about Black doula magic. So maybe, a sentence from each of us about like, what is that Black doula magic, Black birth worker magic that you see? I know Kefri kind of spoke to it a bit. I would say, the spiritual and ancestral power that comes through a person that's been activated as a birth worker is in and of itself something that doesn't have words, but we all know when we've had the call, and you feel it in other people when they show up in that space. And to me, that's a lot of the Black doula magic, is that there's a lot of doulas that are coming from that ancestry, who are activated in an ancestral right and the spirit of birth work. That's beyond their training. Most of us will say that we were doing birth work or some kind of doulaing in our energy way before we even knew what a doula was and were formally trained. And so to me, that's a part of the magic, that spiritual part. Deidre, anything on that?
I feel like, yes, when we can be conduits of it, it's absolutely powerful. And I think that for me, some of that Black doula magic comes from the sisterhood and the partnership, the siblinghood that we create around this work, when we can come together, what we do to truly like shine out to the community as we continue to fill ourselves. This is, to me, there's just so much power in the being together and in the working together and the caring for one another. So again, bring it right back to community.
I agree. And I just compound that. And I believe that strong intentionality and believing in our powers of manifestation, that we create our reality, that we co-create our realities together, and that we are interconnected at all levels. For me, when I really go into when I have good outcomes or when I accept whatever outcome of the birthing family, is because in my prayer work, in my meditations, when I'm seeing it and sensing it and feeling into it and accepting it, I'm connecting more to Great Spirit, to Great Mother, and to the universe. And I feel like it's that magic that goes everywhere we go. And so once we step into that birth room, we're representative of that dark mother womb energy, and they can feel it. They can feel it, and they can bow down too. That's fine. They do a little bow down every once in a while, but we bow to them too. We really accepting and honoring this torch that's been given to us to be representatives of this womb mystery, this torch that we're lighting. One of the things, my father was the midwife assistant to his grandmother, who was the grand midwife of the community. And at that time, my father was born in 1923. He was a young boy. They only had, oil lanterns. So he would light the lanterns for her at birth. They would go off and they would walk down the dirt road with the lanterns. That's all they had. So as long as we keep those lanterns lit, we're going to be all right.
And talking about keeping lanterns lit, how do people stay connected, and how do they find us? And how do folks support community, birth work right here in Southern California, where we are, and our organizations? So Kefri, just maybe speak to a little bit of how to support Frontline. Deidre, speak a little bit to how to support Sankofa, and we'll take a few questions, throw some things in the chat, and come back for more whenever we come back together and make another magical moment.
I'll keep it really quick as far as how you can engage with Frontline doulas. You can consult with us for maternal infant health, workforce development, policy advocacy, mentorship, design and promotion of programs. You can contract with us with our Black Doula Hotline telehealth platforms, or license some of our platforms and co-create something unique for your community, or partner with us. You can train with us, you can volunteer with us, and you can donate to us and fund us. That is one of the biggest asks, is we are here and through the support of the community and our generous funders and sponsors. And so we're very grateful to collaborate with any of you here. Just holla.
And I would say the same, this work is grueling. And one of the things that we're finding is that so many times we as birth workers are so busy doing the thing, we don't have either the skills, the time, or the capacity to continue to build this bigger, whether it's through marketing, through web design, through copywriting, that we want to not just do this work, we want to let others know that we do this work. Like I said, we're about 100 birth workers deep here in the Inland Empire, and still we have families who are like, I didn't know, I had my baby last month. I didn't even know these services were available. So follow us on social media, share our posts, get the word out, talk to, even if you are not a birthing person, or if you're not of childbearing age, letting people know. We do find that there's a huge educational gap around what doulas are in general and how they can really be beneficial. So talk to your friends, your neighbors. We know that even though we have social media, one of the fastest ways to share this work is through word of mouth. So please share in your communities as well as following us, and then come to our page. You can donate on our page as well, whether that's services or money as well. Mm-hmm.
And then if anyone has questions in these last 5 minutes, we are opening up the floor. We hope that we gave you lots of food for thought. And yeah, we're here. Any thoughts, ideas?
I did see a question about postpartum care and how doulas continue to support through postpartum. I can touch on it a little bit. Excuse me. And one of the things that, there are multiple types of doulas. Of course, there's labor and birth doulas, which we've primarily been speaking about today. There are doulas that cover full spectrum care. This means if there is loss, miscarriage, or abortion, doulas can be present. And then there's also doulas for the postpartum period. Again, a doula's job is really to walk alongside a family to help elevate their voice and their choices. And so this would definitely carry into the postpartum period. For the programs that we run, there are X amount of postpartum visits where the doulas can really help support, and hopefully all the cultivation of that community during the prenatal period would be reflected again during this postpartum time, when the doula may not always be physically present. But they have the access, and of course the family can come and surround. But doulas during the postpartum period are probably sometimes even more necessary for some of those sneaky postpartum outcomes that can come up that really put families at risk.
Well, thank you all for being here with us. And Adjoa, we will turn it back over to you.
Well, I just want to make sure there are no questions before you go. I want to thank you so much for this great conversation and chat. We are definitely appreciative of your offering, of your time, of the work and efforts that you have been doing, just to ensure that, we as a community are protected, that you are ensuring that our families thrive and survive, that, many doulas are educated, they're provided with continuing education and support, and then you're making the platform for those who are interested in becoming doulas. And looking at the various pockets around our state that have lack of resources and services. I've been out there to visit with the Sankofa Birth Collective, the doulas there, and sat down and had, a meal, imbibe with you all, and really spent some time just in conversation while we were doing it. We still haven't finished Birthing While Black. We'll get back to the work of that. Now that, I don't know, someone else mentioned, about cooties in our land, and I'm like, yeah, from COVID to monkeypox to Lord, please, nothing else. We just, we don't want it. We're repentant. We are concerned about the environment. And right now, just even remember to talk to your clients about the extreme heat. Get your, waters and liquids in, because we are under extreme heat here. It is time for some collective prayer requests and rain dancing and so forth to bring some water to our city. But safely. But again, we're grateful for the work and efforts you all do. Elizabeth and Tyrus wanted to make sure we acknowledge you, Queen, Dr. Saida and Carefree, for all the work you're doing on the communications team for the Doula Medi-Cal expansion work. Deidre, you've been holding it down for the Inland Empire a mighty long time and making sure you stay connected with those of us across the state. So again, I'm extremely grateful. This chat, you know, we do this. So this chat, we will continue. Folks, look to find out more about, and we'll share for the Black Doula Consortium, as Kefri shared earlier. We'll send out social media information. We most recently supported Kimberly Steele Allairs in her Earth app, so you can download that. I'll make sure to add that into the chat. But again, stay tuned and stay connected, and remember to support these queens in the great work that they're doing. Peace and blessings, you all. Thank you again for being here with Black Women for Wellness. I'm glad to be a partner and supportive and been able to just guide you all into this conversation. You have done a great, excellent job. Thank you so much.
Thank you.
Thank you. Peace, everyone.
Thanks so much. Blessings.
Blessings to you all. All right, folks, we are going to, let's see if Jan is back. So we can have a little closeout conversation. Don't leave just yet. We have more to share with you as she's collecting herself. I do want to drop in the chat. There is a study, and I don't know if we'll have time, but we'll make sure the video is posted, from Dr. Courtney James, who's a postdoctoral, who's a nurse and a postdoctoral fellow, who has is working on a Black mother study. So we want to be able to share that with you all, but as time is swiftly moving through right now, we may not have that opportunity just now. But all the questions that you had and dropped in the chat, we want to make sure that you're able to get those answers. So we'll go back through it and make sure that we have answered and posted and responded to the questions and get the necessary information. So Jan, are you ready for conversation?
Yes, ma'am. I
am.
So
So what did you think?
I put in the chat, thank you to all the wonderful expertise, energy, and information that was shared. And I just want to say that out loud also, that I really appreciate all the work. I really appreciate all the love that folks put into our community. It is so necessary. And I just want to acknowledge it, because people just don't acknowledge how much folks be putting in. They be seeing people late at night and early in the morning and talking with folks all through the night. And that is dedication and love. And then sharing it with the organization, Black Women for Wellness, as well. So thank you all. Thank you. It is appreciated.
Again, yes, we definitely appreciate it. So what more can folks expect to see over the next few days with this powerful 2-week conference that has been going on?
So tomorrow is the men's track. So Akil, who has been listening in, I see his picture in the room, will be holding brothers and holding space for brothers to talk about this whole issue around maternal and infant health, to talk about women's health. I know he has a plethora of brothers who are coming to talk about that. And then many of the folks on here know that Black Women for Wellness does policy. And what they may not realize is that along with the policy, we have a serious civic engagement program where we do door knocking, we do phone banking, we do texting, because we want to make sure folks know what the policy is, but we also want to make sure that the policy is having the intended impact, right? So that's one of the reasons why we have this whole field team. But the other reasons also is because the field team lends power to our voice when we talk with elected officials, right? Because we can tell them we're talking with community and have the data to back it up. So that track is happening this week too, where they're going to talk about how they do their work and what their work is about and some of the findings from the work with the field team. So stay tuned for the men's track. I see Akil dropped in there. Yes, we do. And the other thing that I have been enjoying, and I haven't, I've been in and out today, so I haven't necessarily seen if it happened today, was Black August. So the interns and program coordinators at Black Women for Wellness have really put together an extensive history of what is happening with Black people during August. We've had revolutions in August. We have birthdays in August. We have Independence Days in August. We have marches on Washington. We have Black Women's Pay Equity Day happens in August. So they've been putting together that timeline of all the things that happen in August. And I should also say that August 28th is a very special day in Black history. So there's Ava DuVernay even put out a movie about it. And then we will continue to have the Pan-African news. The good news that is happening with Black folks around the world will only be spread by the Black people around the world. We can't count on the mainstream media to make that happen. So all that will happen this week. We're supposedly going from 9 to 12. We sometimes go a little later.
Mm-hmm.
But, it's because there is so much to share. There is so much work being done. There are so many expertise, so many sheroes who are working on this world on fire that we have, this code red. So, and thank you so much, Audra, for making this happen today. I really appreciate folks who have stepped up and taken the lead on the day, and appreciate all the life that you have given to Black Women for Wellness. So thank you so much, Erica.
You know, you're very welcome. I'm super excited. So y'all haven't really experienced us in our moment, but we do have a podcast, and I am one of the co-hosts of our podcast. I'm just saying, two Black women with opinions. So we'll be bringing you more of that, and we're really going to get into some real hard-hitting conversations. We took a pause for so much that was going on, and to, you know, as we went through the cyclical levels of COVID and whatnot. But yeah, Gabby said drop the link. We will definitely share and drop the link for the next one, but you can find us on Spotify. Are we on Spotify? We're on Spotify and Buzzsprout.
We're on Spotify, Buzzsprout. You might even be able to find us in Apple Store also. I had to go on mute because, you know, living in the neighborhood, working from home, you get all our noises from loud cars to set off everybody's car alarms to just life.
Yeah, no, it happened. But I wanted to go back real quick and say, you know, you all tune in tomorrow, because Jan and even my AIM colleagues and partners know I've been a big proponent of bringing men into the conversation around reproductive health and justice. They know I have fought many hard and long conversations and battles, because I say we are not out here having babies by ourselves. We're not impregnating ourselves. These men need to be a part of this conversation. We need to talk about, you know, where we're at with our femininity and masculinity. I'm super excited because Black Women for Wellness, and I just sent it out to our AIM listserv. So if you're interested in being a part of the African American infant and maternal mortality work throughout LA County, I will drop my email in the chat so you can get on our listserv and receive the emails. But Jan, Black Women for Wellness, has partnered with Planned Parenthood LA and their Black Equity Initiative, Health Initiative, and they're having these conversations called Soul Friends. And so the next one coming up next week on the 23rd is talking about feminine and masculine toxicity. So that should be a very good conversation, bringing men and women and folks together to have some dialogue about our toxicity, which I think is very apparent. I know when we have one of our next conversations, I'm really going to be bringing up intimate partner violence and domestic violence in our community, and really looking at, you're welcome, Brittany. I'm really looking at what we're going to do to address these high rates, and we're not attaching this, please folks hear me clearly, we're not attaching this to the infant and maternal mortality rate at all. We're just talking about the toxic relationships and the outcomes, the negative outcomes that are happening in our community on the daily. Is this associated with the pandemic? You know, the mental health issues that we're seeing. Many of us saw and have heard the news, sadly, about the 6 folks that were killed a couple of weeks ago in LA in this car crash. And our hearts and you know, prayers go out to the family and the families, and you know, the woman whose infant, her unborn and born infant were killed as well. But our hearts also go out to the sister who was apparently has been in a mental health crisis for a mighty long time. And so we have to talk about some of these things, and even if they're uncomfortable, we have to make it you know, a conversation to happen. We also need to talk about, go ahead.
I was gonna say, we can actually do this every day of this month, because just to have conversations about the mental health of our community at this point in time, how people are, quote, self-medicating with various types of drugs, etc., is some crucial things, and they do have intersection with our maternal and infant health. And that's something Black Women for Wellness uses a reproductive justice lens, right? We know that the condition or state of our water, the air we breathe, are part of reproductive health. And that's why we talk about that. We know that mental health is very much intersected, as well as law enforcement, right? And just because they talk about whenever we have one of these police killings, which we do have, that it impacts all of our community, and it impacts not only that mental, but emotional health and well-being. Do we feel safe?
Right. And if y'all can give us another, like, probably 5 to 10 minutes, we explore a little bit more, and we'll drop some videos that you could see on your way out. But here's the other thing, is we want to talk about too our encounters with law enforcement, right? I don't know if any of you saw the sister who was asking the officer, and he was African American too, was asking the officer about, you know, why was she being, you know, given a ticket, and thinking that you don't have to sign the ticket. And really and truly, all I saw in that is that he got upset with her for questioning him. And his mindset was, at first she said, well, I'm not going to sign it. And then he said, well, if you don't sign it, you're going to go to jail. That's just what I shared with this gentleman. And so she hadn't heard that part, and she heard it. And then, you know, at the point she was going to sign it, he was in disagreement, like, now you're being arrested. And so it escalated to where it didn't need to be. And we need to talk more about that. We need to talk about, you know, de-escalation, like folks who are trained to de-escalate. We need to talk about, you know, mental health responders, who's available, who can folks seek out. Folks are needing grief counseling, and they're needing support. Our children are needing support and information, and just around all that has transpired. We talk about these last 2.5 years, but we can go back for decades and even centuries of why counseling and mental health support is necessary, and how folks, I'll say this so Jan can speak, is that many times there's so many services being offered here by our community partners and whatnot. And we even have free food drives and resources and giveaways. And sometimes our own people don't show up, and folks are like, well, Black folks aren't showing up. And we have to talk about that too. Why aren't we showing up when there's resources made available? Is it about the delivery of services? Is it our lack of awareness that these are available? Or what is the issue at hand? Jan?
I think some of the issue is trust, right? Because so many times when we have a government we do not trust, because it has betrayed us time after time after time. And that it has offered us free, but there have been so many strings attached and hidden agendas that is quite alarming, but that distrust is passed down through generations and generations. But I'm going to say one reason for you all to tune in to, I'm just saying, to Black Women with Opinions, because we do have these podcasts to talk about some of these issues, and we have special guests that we bring in who have expertise and or experience with some of the issues, not only with the the trust factor of Black people in government and providers and community-based organizations, but also the mental health perspective. We talk about maternal health. We talk about reproductive justice from an international lens also. So good reason to tune in. Oh, and I forgot, we talk about Nollywood in the movies that we have been seeing. And I am absolutely looking forward to Wakanda Forever. So we're gonna put together a big whoop-de-doo for the opening of the movie.
Some trainings. We'll talk about some trainings.
Prepared for that. We're gonna do a big, it's gonna be a cultural experience. How about that? So with that, I am grateful for today and looking forward to tomorrow. The one thing I do want each and every one of us to leave with is hope, because hope is what gives us that energy and aspiration to fight another day. So have hope, have faith, have confidence, have knowledge, be secure. We shall prevail.
We shall prevail. Thank you so much for that, Jan. I am going to, unless there's anything else, I'm going to pull up these lovely videos that were shared with us for some folks. Just to close out with, Kyra's had shared an amazing birth story for one of her clients, and I want to be able to make sure that we can share that with our community. But if nobody has a burning question, a burning thought, I do thank you for allowing me to be here and represent for our Black infant and maternal health, but our infant and maternal health community. This is a part of reproductive justice. We will be talking to you all more about why, even advocating for our women and girls' health is so critical and important in this phase, even after post Roe v. Wade, and how, even as Anyema shared, that there are several counties that lack the OB-GYNs and the resources and services. Some of them are really what we could call hospital deserts. They lack the resources there. And so we have to do the work to make sure there are midwives available, make sure there are doulas available, and make sure we talk to our hospital and clinics about being able to provide those services. But then we are also supportive of those who want to have in-home birth support. Further, we want to ensure that families have the opportunity, I will make sure that happens, I'm sorry. Those who have a desire over their preference to birth or not, are fully supported. And we don't want people to be out here having risky procedures. And that is what is critical and important, is that folks do not get out here and have risky procedures that will cause death to them. And we don't want the over-criminalization of women who may have stillbirths or miscarriages. And, that has happened in Northern California. I think it took a while before this one woman was even released. But thankfully, I believe they have had her sentence overturned. So again, I want to stop and share that.
4 years though.
Yeah, she did. She served how many years, Jan?
4 years.
Yeah.
4.
Which is absolutely ridiculous. Absolutely absurd. And last but not least, as Akil gets ready to drop in the chat, and I'm going to close out with this video, as Akil drops in the chat, last but not least, I think that this would be a vast different outcome if there were men, if there was some real legislation over men and they're impregnating women. And, if there was some impact on that, there is a representative in another state who is looking at the banning or something about use of erectile dysfunction type of services. I have to drop that in.
Chemical castration?
No, not at all. But if there was a penalty for the men, I bet you.
Really, Angela?
To go off camera for that one.
It's serious. If we
came up,
and you started, oh, come on.
If we came up with some legislation over male bodies, I can assure you that they would have been like, oh, we're not doing anything with Roe v. Wade. We're going to leave that alone. So anywho, I would, Akil, please drop in the chat how folks, he came off of mute for that, how folks can attend the conference. Thank you, Arnidra. We'll close out with this one last video, maternal health equity and the role of a doula. It's about 4 minutes, and just, you know, observe, watch, get your stretch on. And again, folks, we thank you for your time. We know time is valuable. We appreciate your presence here. And we know that you are sheroes, heroes. I don't know if I can give another term for the non-gender, but those are the terms we have right here now. But you are our folks that are leading this work, and we're excited about what you're doing. Know that you are valuable and invaluable to us. Know that you can be a part of this effort and work wherever you decide to join in. Please connect with us. I dropped my email in the chat, and look forward to more information coming. You have 3 more days of the conference. Stay tuned, tune in, go back and view. I believe it's on YouTube. Where can they find the previous days that were offered last week and even today, this viewing, Arnidra?
They won't actually be able to view them until after the conference.
Okay.
And they'll be able to view them on YouTube. We're gonna put them on Hoover first because we have the Hoover platform to the 31st. Then they'll be able to view them on YouTube.
Thank you. All right, let me know. Give me a thumbs up or just let me know you hear the sound.
One of the biggest barriers to care is when there's a breakdown in communication. But when you have a shared experience, you are able to be an advocate, be there with them and for them.
Thank you.
The simplest definition of a doula is that we are coaches, helping our moms find and navigate resources so that they can have the kind of birth that makes sense for them and their family. A Black mother is anywhere from 2 to 6 times less likely to see that baby's first birthday. There are birthing people who are not being heard, and it leads to tragedies or emergency situations. So it is critical to have this social support that leads to much, much better outcomes. I knew that I wanted to have a home water birth. Some statistics show that I guess someone my age, it's best to get induced, it's best to have a C-section. There was no signs of distress that me or the baby was giving for them to try to push for me to even think about a C-section, except for the fact that, hey, you're 41 and you have gestational diabetes. I was trying to stay as healthy and positive as possible during the birth. Kyrus gladly accepted to be my doula, and it was like a weight lifted off from my shoulders. I went into labor on a Friday. I thought my water broke. I was like, okay, I'm definitely possibly in labor. I let Kyrus know, and she was like, okay, well, I'll meet you up there shortly. They checked me in that morning. Around about 8 p.m. that night is when the doctor said, it's been so long, and I'm gonna give it a couple of more hours. If this baby's not here by midnight, we're gonna do a C-section. That really threw my spirit. I was able to reassure her again and again that she had been completely compliant with her care, that she and her baby were just fine. Kyrus was like, we're gonna do this. We're gonna make sure that this baby comes on her own. You need to listen to your body. That was a big help to make sure that I could have the natural birth that I wanted. It was like 15 minutes before this deadline they gave me. The doctor wasn't in the room. The nurse was rushing to the door to get the doctor. She's like, doctor, the baby's coming, the baby's here. And Kyrus told the nurse, it's too late. We don't have time to wait on the doctor. This is the baby's head. Kyrus ended up catching upset as she came out. I really believe had Kyrus not been there, I would have been pressured into having a C-section. Kyrus made a huge impact to ensure that my birth plan went as close to planned as possible.
I love you.
Yes, ma'am. Systemic racism is still embedded in our medical care practices. As a Black woman, your risk of poor birth outcome does not change with income. The Blue Shield of California program has a unique aspect of sending resources into a community to be able to provide care for itself. That is a setup for success when you can relate to someone who is providing care to you. As a birth worker, it is a dream come true that someone recognizes the value of the work that needs to be done, that is being done, and that there's a closing of the gap between the resources and the need.
Thank you all so much. Appreciate you for being here.
I've been getting paid
you all
$1,000
have
a month.
you all have a great